IMDEA Food Institute, with the International Union of Nutritional Sciences, within the framework of the annual food agenda, EIT Food Projects, presents the webinar, Can we ensure healthy and sustainable nutrition? An event released by marketingdirector.com.
Good morning, ladies and gentlemen. Can we ensure a healthy and sustainable nutrition for the 10 billion people who will be living on this planet Earth in the year 2050? Welcome to this webinar organized by IMDEA Food Institute with the support of the International Union of Nutritional Sciences and within the framework of the annual food agenda project of EIT Food. We are also proud to contribute to the celebrations of FAO's 75th anniversary of the World Food Day. IMDEA Food in Madrid, Spain, thanks you for connecting with us in this webinar where experts from around the world will present different approaches to the challenge of providing a healthy and sustainable diet for a growing world population which will reach 10 billion people in the year 2050. Now, it's my pleasure to introduce you all to Dr. Ana Ramirez de Molina, Deputy Director of IMDEA Food, and to Professor Alfredo Martinez, President of the International Union of Nutritional Sciences and Director of the Precision Nutrition and Cardiometabolic Health Program at IMDEA Food, who will be leading this event, which I hope you will find very interesting. Thank you so much. And Anna, please.
Thank you, Guillermo. Good afternoon. Thank you all for being here today in this event of the World Food Day that is organized by IMDEA Food Institute and EIT Food and the project Annual Food Agenda. IMDEA Food Institute is a research center that is promoted for the community of Madrid in Spain that works in precision nutrition and health and has the aim of conducting to the society all the advances, scientific advances and innovative technologies that are being developed in this area. We are partners of IMDEA Food, that is a European initiative that is focused on conducting sustainability and conducting a healthier nutrition to be able to achieve the question of this webinar. So we want to thank you all for being here. We are very proud of organizing this event and having all these experts that are today with us in this World Food Day. So I let you with Alfredo Martinez that is going to start the event. Thank you very much.
Good morning, good evening to all attendants all around the world. As you know, today is the World Food Day that is held every year, the 16th of October. The World Food Day 2020 is this year coinciding with FAO 75th anniversary, in a very exceptional time as many countries are affected by COVID-19. World Food Day is considered as the opportunity to call for global solidarity to make sure the threats from COVID and agricultural livelihoods are confronted and able to get back to their feet. It's also an opportunity to everyone play a role in capacity building and changing the way we produce, we transform, and we distribute food. While many FAO office and partners may need to reconsider the format of the World Food Day, it's time for action. Therefore, today, FAO 75 is aligned with the spirit of the UN in order to commemorate and looking into the future we need to build together. Grow, nourish, sustain together. This is a great opportunity to commemorate also the grant of the Nobel Peace Prize for 2020 to another United Nations agency, in order that the World Food Programme is the world's largest humanitarian organization addressing hunger and promoting food security. In this year, we are commemorating both the FAO Day for Sustainable Food and Nutrition with the Food Programme in order to fight against malnutrition. All of you are welcome, and I appreciate also the role of IUNS, the International Union of Nutritional Sciences. One of the mission is just to fight against malnutrition and using modern technologies like this online webinar to provide capacity building and also to make sure that malnutrition should be fight with all our efforts in order to understand that well-being is a human being right. Thank you very much. Hope you enjoyed this webinar that we have prepared from Spain. Thank you.
Hello. It's an honor, it's a pleasure to have to be part of this meeting, interaction on the World Food Day. And I couldn't show my admiration to IMDEA Foods for gathering so many people from across the globe to share in this special celebration of the 75th birthday of FAO, who have been working relentlessly. Now, I am going to be speaking on a very important topic on the implementation of Pan-African dietary guidelines. As you can see on the screen, my name is Francis Zotor of the African Nutrition Society as a trustee and also a professor of nutrition at the University of Health and Allied Sciences. My other affiliation is as a council member of the International Union of Nutritional Sciences, representing Africa. Now, in speaking about I'm going to share my screen with you. Sorry. Okay, let's see if I can get it right this time. Okay. I can get the screen. Okay, thank you. Sometimes you need to get some bit of help. Okay, so we are back on track. Now, the reality with our food environment, there is a global consensus without a shadow of doubt that our food environment is becoming increasingly unhealthy. What do we see? We see an increasing abundance of cheap, ultra-processed, and low nutrient profile foods. We also notice that there is a diminishing availability and reduced market share of healthy foods, and that is becoming a reality. We see the proliferation of ultra-processed foods, which is widely distributed across the globe, with aggressive advertisement going on, and the prices are very, very low. Now, what it means is that obtaining healthy diets in an unhealthy environment has become very challenging. Now, when we talk about food-based dietary guidelines, also known as dietary guidelines, what this does is it establishes the basis for public food and nutrition, health and agricultural policies, and nutrition education programs. The food-based dietary guidelines fosters healthy eating habits and lifestyle. Not only that, it also provides advice on foods, the food groups, and dietary patterns to provide the required nutrients to the general public to promote the overall health and prevent chronic diseases. Now, when we look at Africa, Africa has 54 countries, but regrettably, there are only 6 to 7 countries that are food-based dietary guidelines. We have Sierra Leone, Benin in West Africa, we have South Africa, we have Nigeria in West Africa, Kenya in the east of Africa, Namibia in Southern Africa, and Seychelles. I added Ethiopia here just to emphasize one point, which I would emphasize later on. Now, looking at a publication by Anna Hereford, who carried out an extensive work on food-based dietary guidelines by countries from the period 2000 till present. These are the countries around the globe that do have food-based dietary guidelines. And out of this, only 7 in Africa do have food-based dietary guidelines. Now, I want to quickly take you through those countries. If we look at Namibia and Nigeria, they have food-based dietary guidelines around the year 2000. Namibia's food-based dietary guidelines applies to the healthy population aged 2 years and older. And it was developed by a multidisciplinary team with collaboration from FAO, UNICEF, and the World Health Organization, with the local ministries wading in and helping. Then we have Nigeria's food-based dietary guideline, which was developed in the year 2000 and published in 2001. And the guidelines applies to all healthy Nigerians, also with funding from the World Health Organization, Helen Keller, and the international community. Then we have South African that came in just around 2003 with emphasis on guidelines for South African population 5 years and older, and the pediatric food-based dietary guidelines for children 0 to 5 years. Now, this was launched in 2012 with financial support from FAO. Close to that time, before that time, in 2003, we also have the Seychelles that had its food-based dietary guidelines in 2006. And this was developed by the nutrition unit of the Ministry of Health and was targeted at healthy individuals 2 years and above. Then we have Benin coming in at 2015 for 2 years and over population, and their guideline is still pending endorsement from the National Food and Nutrition Council. Then we also have Sierra Leone that published its guidelines in 2016 aimed at the general public. The draft guidelines was validated and reviewed by representatives from a task force that they put together, the WHO, the SUN Initiative, and FAO. Last but not the least is Kenya, who published its dietary guidelines in 2017. And this was targeted at the general population with key messages provided at each stage of the life cycle. Again, funding was provided by the WHO, FAO, Micronutrient Initiative, and the World Food Programme. So this clearly tells us that all these food-based dietary guidelines couldn't have been done in country alone. The international community gave technical advice, input, and help in funding the provision of the dietary guidelines, which we do appreciate. Now, the reason I brought in Ethiopia is that Ethiopia is far advanced in its development of the food-based dietary guideline. They currently have a steering committee that is multidisciplinary with technical assistance from IFPRI. What they have done beautifully is to publish its methodological approach with the hope that other African countries may find a journey in constituting their food-based dietary guidelines as helpful. I also want to talk about the case of Ghana that has just begun its food-based dietary guideline journey. What I see about the beauty of Ghana is they have a very well-balanced, multidisciplinary working group. You have the UN agencies from FAO, UNICEF, WHO, all attending their weekly 3-day meetings. They are currently conducting an evidence review, which will be validated. They are prioritizing issues, developing technical messages, which will be tested among potential users 5 years and above. They would also target institutional users and then carry on a revalidation. Now, Ghana's intention in conducting a comprehensive and coming out with a comprehensive food-based dietary guideline is to publish a supplement that will serve as a model guide for other African countries who may need to embark on this initiative. Now, this intertwined network might sound a bit complicated. Guidelines to eat those foods, and in the case of Ghana, they've got to dietary patterns of the high consumers of intake of the options for the diet factors in terms of the dietary related factors well-nourished Africa is rich. Challenges with
Hello, everybody. So First of all, I would like to thank the organizers, Guillermo, Alfredo, Ana, for inviting me to this event. I think that is very important to celebrate this date. So I'm going to try to share my presentation. So now I hope you can see it. Okay, so I'm going to talk about childhood obesity because I was told you can see it. Okay, I'll try again. Okay, finally. Okay, so childhood obesity is a very important problem we have all over the world. So the prevalence of overweight and obesity among children and adolescents aged 5 to 19 has risen dramatically from just 4% in 1975 to just over 18% in 2016. The rise has occurred similarly among both boys and girls, and in 2016, 18% of girls and 19% of boys were overweight. So according to the Imperial College of London and the World Health Organization, if these figures are maintained, in 2022, just in 2 years, children and adolescents will suffer more from obesity than from any moderate or severe weight deficiency. So this is a general aspect of childhood overweight in the world. So we can see here that, for example, countries such as India or Burkina Faso has a very low prevalence of overweight. However, Nauru in Oceania has a terrible situation regarding childhood overweight, and also in Spain, Argentina, South Arabia, Libya, Australia, Argentina, and the States, well, we have a very high prevalence. So worldwide, near 3 million people die each year as a result of being overweight or obese, and estimated around 35 million of disability-adjusted life year are caused by overweight and obesity. The total non-communicable diseases mortality, around 40 million of the 56 million global deaths in 2015 were just due to the non-communicable diseases. So it's a very important problem to take into account. Also, 48% of non-communicable diseases deaths in low and middle income countries in 2015 occurred before the age of 70. And also 80% of premature heart disease, stroke, and diabetes can be prevented. So I think that we have to take care about this, all the governments, centers of research, universities, all together. We have to take these figures into account. So there are some diseases associated with obesity, you know very well: metabolic syndrome, diabetes, cancer, non-alcoholic fatty liver disease, neurodegenerative diseases, inflammatory bowel disease, atherosclerosis, autoimmune diseases, and especially infections and allergies are more prone. These people, obese people, are more prone to infections and allergies. And we have to take also into account that obesity is defined as a process of premature aging. So this, this is something to bear in mind, because immunosenescence is what we are going to find in elderly people, and these people, their immune system is depleted, so the susceptibility to infection, severity of them are much higher than in adults, and also the efficiency of vaccines are much lower, so the incidence of tumors is going to be higher, so morbidity and mortality is going to be increased in relation to adult people. In addition, there is a process called inflammaging, because this is a low-grade chronic inflammation. So, well, we have here, and for a lot of many years, we knew that there is a very strong relationship between the immune system and the nutritional status. But right now, we know that microbiota has is related, very closely related, not only to the immune system, but also with the nutritional status. But not forget the psychological conditions. Perinatal and postnatal period is very important early in the early years of life. So during pregnancy and the first 2 years of life, we have to take a very important care of the newborns, because during pregnancy, well, it's very important the maternal diet, the nutritional status of the mother. Also, if there are some drugs taken by the mother. But in the postnatal period, well, we have to think about the household size and pets with the family, also where the newborn is living. In a rural conditions, or an urban city, also the conditions of the delivery. So, well, all these factors are going to be very important for the development of the infant gut microbiota and the immune system. So also in the adulthood, lifestyle factors are going to be also very important, because they can be related to obesity and also other non-communicable diseases. And for sure, microbiota is in between, so also related to emotional distress. So regarding if there is a obese situation or a control or normal weight, the microbiota is going to be different. So these are the most important lifestyle determinants affecting microbiota: diet, food behavior, weight fluctuations, physical activity, sedentary habits, sleep quality and quantity, alcohol, tobacco, and for sure, stress. So strategies of public health should be addressed to promote a healthy lifestyle by maintaining an appropriate weight, a varied, balanced, and moderate diet, as well as a regular physical activity. Therefore, it's essential to investigate further strategies to prevent in children and adolescents the development of risk factors that promote metabolic diseases in the future. So immunonutrition is there. The aim of immunonutrition is to promote life quality, to prevent infections and inflammatory processes. So taking into account stress conditions, food intake and behavior, physical activity, and for sure, watching weight. So thank you so much.
Good afternoon, Europe, and good evening from Thailand and Asia. Thank you, IUNS, for inviting me to this webinar and giving me the opportunity to talk on food-based strategies for healthy diets and nutrition, the Asian perspective. At the ICN2, countries had committed to reform their food systems to enhance sustainable food systems across multiple sectors to provide year-round access to a variety of foods to meet people's nutritional needs. I would like to highlight some evidence from nutrition-sensitive policies and interventions from selected Asian countries that have made contributions to improving nutritional status. Central to this has also been the adoption of a community-based approach, which has served as a sustainable mechanism to improve food security and reduce child malnutrition. When we look at the food groups as percentage of dietary energy supply in selected Asian countries, we find that dietary energy supplies serves as a useful metric for monitoring how well a food system supplies a diverse range of nutrients at an aggregate level. Now, this is necessary, but not a sufficient condition for diverse diets among the populations as a whole. When we look at the analysis across countries, we notice that this indicator has stronger correlations with maternal and child undernutrition outcomes than the estimates of total calories per capita. The case of Maldives and Thailand shows you where there is improved diversification as well as commensurate reductions in child undernutrition. Though Bangladesh has a large proportion of dietary energy supplies from cereals, it has still made steady progress in reducing child malnutrition. Some authors have shown negative correlations with child undernutrition, as in the case of India, Pakistan, and Laos. Now, when we look at the nutrition situation across Southeast Asia and South Asia, we notice that in Southeast Asia, on an average, it's about 30% stunting, a little less than that, except for countries like Vietnam, Malaysia, and Thailand, which have lower prevalence. Analysis also shows that wasting is a public health problem in the Southeast Asian region, which needs to be addressed through preventive and curative approaches. In the case of South Asia, which has one of the highest stunting rates in the world, we find that poor infant and young child feeding, poor maternal malnutrition, and inadequate hygiene and sanitation are some of the major causes. However, you will notice that Sri Lanka, Bhutan, Maldives, and Bangladesh have made progress with lower rates of child stunting, although inequities between regions remain. When we then come to certain countries with policies and programs which have shown good lessons for improving diets as well as childhood malnutrition. We noticed that Bangladesh has been developing policies and programs and implementing food-based strategies for several years, and in the last decade especially, some of these are found to be impacting diets as well as nutrition. In particular, the role of agriculture and food sectors have been valorized to demonstrate dietary improvement and nutrition improvement outcomes. The country investment plan that you can see on the right side has been an explicit case of using the production to plate approach, which encompasses a range of activities from production, processing, marketing, and consumption domains. You can see over here the different pillars of the nutrition sensitive food systems, ranging from production, market access, nutrition and utilization, social safety nets, and an enabling environment for achieving food and nutrition security. Nutrition education has been integrated through the production, processing, and consumption linkages. And we notice that when food systems are designed with a nutrition orientation, they offer an opportunity for an adequate supply of energy and nutrient-dense foods for a healthy diet. Then we come to research, which has been the backbone to guide and inform policy in many Asian countries. And FAO has been technically supporting the development of evidence-based policy tools that have helped to establish desirable dietary patterns, notably complementary feeding guidelines, improved complementary feeding recipes, food composition tables, and desirable and dietary guidelines. As part of desirable dietary patterns, we also notice that it is important to look at the nutrition returns for the money spent or the nutrient density of the foods that you are really promoting. On the left side, you can see the natural nutrient-rich score, where we find foods like cereals, oils, and sugar. They provide mostly energy, but minimal protein or almost no protein and no micronutrients. On the other hand, you will see vegetables, leafy vegetables, yellow-orange vegetables, fruits, and eggs, as well as fish and some animal foods, which provide adequate micronutrients as well as energy and protein in the case of animal foods. So when we look at the nutrient density in terms of cost per 100 calories of the consumed foods, the carbohydrate-rich foods that you see at the lowest quadrant, they are found to be energy dense and relatively cheaper, but nutrient poor. On the other hand, meat and fish, which are more expensive, give you higher returns for the 100 calories that are calculated. On the whole, but you can see that eggs, milk, fruits, and leafy vegetables are found to be giving you much better returns at moderate costs that are being spent. It is important, therefore, to encourage the intake of foods which are more nutrient dense and less energy dense to enhance nutrient intake, while at the same time limiting energy consumption to avoid the risks of overweight and obesity. Impact assessment of nutrition-sensitive investments showed that interventions such as home gardening, smaller fish farming, or the promotion of local indigenous fish species, fortified rice distribution, social safety nets, and balanced plate nutrition or nutrition education were found to be cost-effective interventions. There's another important program known as the Sapling, which is covering countries like Bangladesh, Bhutan, India, Nepal, and Sri Lanka, which have focused on policy advocacy, supporting both nutrition-specific and sensitive interventions, strengthening the knowledge hub with technical knowledge and tools, and facilitation across multiple sectors in order to promote affordable diets as well as nutrition. When we look at some field programs wherein agriculture has been integrated with health for improving nutrition, again, we have the classical example of southern Bangladesh, which has high salinity as well as waterlogging, where with an integration of capacity building, transfer of technologies across agriculture and health and nutrition, there was improvement across a 3-year period in the women's dietary diversity, especially pregnant and lactating women, as you can see in this chart. Then the prevalence of anemia among school young children less than 2 years of age also showed improvement from the baseline to endline, and undernutrition among young children was found to be reduced, notably with reference to significant declines in underweight, marginal declines in stunting, and some decline in wasting. More recently, following the COVID in March 2020, an assessment of nutrition awareness, behavior, and food security during COVID was done with reference to youth and adolescents under the IUNGA program, that is the Youth and United Nations Global Alliance, it was noticed that the assessment of food insecurity during COVID was studied, and it was noticed that 36.4% of youth and adolescents, household families, were moderately severely affected by food insecurity as compared to the national average, which was 31.5% in the pre-COVID situation. Indeed, poor diets impact nutritional status and also affect diets. When diet quality and micronutrient adequacy were assessed, it was noted that children and adolescents who were covered by the UNGA program, the Nutrition Challenge Batch program, had better diversity scores and micronutrient adequacy. However, you can notice that between 26 to 34% of the children were found to have minimum dietary diversity scores. We then come to the urban food systems in the Southeast Asian informal sector, where we notice that the main intervention points include food safety communication, policy enforcement, as well as training and capacity building. However, the main need remains to plan the expansion for healthy diets. We also go to Cambodia and other countries, Nepal, Bangladesh, Vietnam, where we've noticed that linking agriculture and nutrition education to improve infant and young child feeding has shown some useful lessons. When the agriculture sector was used as the entry point, promoting diversification of agriculture and food systems integrated with nutrition education, intensive nutrition education, the results showed improved breastfeeding practices with the reference to the Alive and Thrive program, also with complementary feeding practices having improved, minimum dietary diversity among women, vitamin A intake, household hunger which had reduced, and food security which had improved, as well as stunting, especially in the case of the Shoardo program in Bangladesh. When we look at the leveraging the agriculture for nutrition in South Asia, the LANSA program with 4 focus countries, Afghanistan, Bangladesh, India, Pakistan, it was noticed that the policies which were designed and interventions which were implemented were included an integrated approach with the impact to improve nutrition. It was noticed that the average household dietary diversity scores increased significantly from the baseline, which was less than 5 inadequate diets, to more than 7 in the case of endline, which was found to be significant. When we look at an integrated home gardening program, including horticulture, livestock, and fisheries in Lao PDR, supported by an intensive nutrition education component over an 18-month period, it was noticed that there was decline in rates of undernutrition among children from 23.2% to 15.9%, a decrease by almost 8 percentage points during the period of implementation. The case of Thailand is a classical example of success, wherein micro-level planning using a set of minimum basic needs indicators that have informed macro planning and have led to the demand for a menu of activities integrated across agriculture, health, and nutrition, targeting the poorest districts and prioritizing mothers and children. Using the process of social mobilization and an optimum ratio of 1 community volunteer to 10 households, Thailand was able to scale up its outreach and coverage of both health and nutrition services, and that was able to reduce malnutrition from over 40% to less than 10% within a decade. So to conclude, the main messages are: there is need for simultaneous, comprehensive food and nutrition security policies, nutrition capacity strengthening, and action on the ground. There is need to integrate nutrition-sensitive agriculture within a multi-sectoral context with the aim of delivering healthy diets to impact nutrition outcomes. Multiple entry points need to be used to maximize nutrition impact. Indeed, monitoring and evaluation are fundamental. However, it requires investments and entails long-term planning and vision. Ultimately, there is need for strengthening an enabling environment for nutrition programming and adapt international guidelines to country contexts and situations and for national policies and guidelines. Thank you for your kind attention.
Thank you so much. We have benefited from the presentations from these wonderful, wonderful experts looking at food issues in nutrition. And I cannot say how grateful and honored I am to have listened to all the speakers. But before I ask a few questions to not only Professor Ascension Marcos, but also to Lalita, I want to draw your attention to the IUNS. Now, a lot of you may not know about the IUNS. The IUNS is an acronym, but simply put, is called the International Union of Nutritional Sciences. Now, this acronym, IUNS, is responsible for overseeing the direction for nutrition at the global level. And they are drawn from across the globe. So we have President Alfredo Martinez, who is the president, and then various other officers. And they oversee the direction for nutrition. So anything to do with nutrition, it is your responsibility to oversee that nutrition toes the right line. And I've been honored to be part of the council to form the IUNS. Now, the IUNS also have what you call the task forces. And I'm glad that Professor Marcos and Dr. Batacheji has been talking along some of these areas. We have the task force that focuses on nutrition and cancer, looking at issues on nutrition and their relationship to cancer. We have a task force that has to deal with Okay. Then we also have a task force involved in the dietary fat quality and international malnutrition, and also a task force dedicated to what we call capacity development in nutrition. We have various others that we draw in to look at traditional and indigenous food systems and nutrition. And then there are others who are also involved in looking at the risk and cost effectiveness of micronutrient interventions. Not to forget precision nutrition. So you see that IUNS oversees different types of task forces, drawing in experts to look at various areas of nutrition that is relevant to the population across the globe. So, questions. And
Can you hear me?
Yes.
Yes.
Thank you very much, Francis, from IUNS. I would like that we are going to keep the schedule. Therefore, I would like that Lalita and Ascension Marcos make some emphasis on the take-home messages they want to provide to the audience. In any case, I want to mention that IUNS, the International Union of Nutritional Sciences, has organized this activity, this webinar, in order to celebrate the FAO 75th anniversary, but also the World Food Day. Therefore, Lalita, as representative of FAO, and also Ascension Marcos, as former president of FENS, can have a view of how the intervention are related with the day we are celebrating today. Then we will have about 4 minutes for each, okay? Lalita, please.
Okay. In keeping with the theme of the World Food Day, we would promote a food systems approach which really focuses the different chains from the production to plate, covering all the domains of the food system, which includes production, access, marketing, social protection, consumption, nutrition, as well as enabling environment and social protection. Thirdly, secondly, this has to be integrated with a strong nutrition education component, which can not only produce and promote the healthy foods, but also enhance the consumption. Food safety elements have to be integrated along with this when we talk about healthy diets. Ultimately, in order to provide evidence-based policies and influence and inform the food system, we need to have research which really brings out those policy priorities and which tell us how can we afford a healthy diet. Now, healthy diets, we may talk about it academically, but in reality, what is the affordability by the poor man, by the common man? And in this context, I would like to draw your attention to the recent recommended dietary allowances which have been released by India, which are actually talking about reducing our calorie intake, because today we do not expend that much of energy like how we used to do 10 years ago. So when we talk of desirable dietary patterns from the food, I believe that the food systems have a role to produce healthy foods, which are possibly not always energy rich, but should be nutrient rich and micronutrient rich, as well as processing of foods which are nutritious. So this is my main message. Food systems need to be valorized in order to promote healthy diets, and that can impact the delivery or nutrition outcomes.
Thank you. Could you just give us a summary and take-home message from your view in Europe? Please, atención, Professor Marcos.
Well, I think that although food safety has a different meaning depending on the countries, anyway, I think that it's very important to watch weight. Weight is a big enemy to develop different diseases all over the world. So I think that we have to take into account the problem that obesity is generating. So in addition, there is a deficit of micronutrients in obesity, not only in undernutrition. So it is something that, in our view, it's important to maintain an appropriate weight. So this is our message from Europe. I don't know, probably Alfredo didn't like this this message because he went away.
I also believe that pricing policies need to look at the affordability of, especially we talk about healthy diet, especially with reference to fruits and vegetables, whole grain, dairy. These are all very vital foods. These need to be considered when we look at pricing policies.
Yeah, but it is something that I think that nutritional education from the beginning is very important. So not only at schools, but also for parents and teachers, because everybody thinks that they know how to eat, and finally nobody knows that, and the information is not good. There is a lot of information in internet. You can see everything, and many diets, but all of them are horrible. So it's better to continue with a normal diet, with full of fruits, vegetables, cereals, legumes, and some protein coming from meat or fish. But we have to have a diet based on
approach.
a lot of fiber.
Yes, absolutely. And I think we have to set nutrient targets in the policies in the production stage. It's not only food production targets, but nutrient production targets or nutrient targets in order to influence desirable diets. I think this is very critical.
That's it. So
I think I agree. The messages that you and I have shared are similar, because we've got to cut across the spectrum of both undernutrition, overnutrition, dietary excesses, because this multiple burden is a problem of all countries, more so this side of the world.
That's
okay. Thank you very much. Also, as probably you know, Professor Prakash, as Vice President of the International Union of Nutritional Sciences, he thought to present a talk about sustainable food and nutrition security for health and wellness in the context of COVID-19 pandemic. Could the speaker just mention and just give us some views about the international perspective from this pandemic, from a nutritional point of view, of course?
Yeah.
Please, Lalita first. No, please, Ascensión first.
No, it's okay. Well, the problem with this pandemic is that those people with overweight and obesity, also elderly people, well, had more problems, and the disease was harder in these people. So that's why I would like to insist in the importance of maintaining an appropriate weight, because the virus is going to be more effective in those people with obesity, not only because of the age, but because of the weight. So also in young people is a big problem. So, well, undernutrition is also a big problem, especially in residences where elderly people live during the last years. And, well, at least in several countries in Europe, there have been a big problem because of undernutrition. So, well, it's something that we have to bear in mind, and to adapt a good diet for elderly people, not only in hospitals, but also in their residence. And, you know, Lalita.
Yes, okay. On the COVID issue, speaking from this side of the world in Asia, COVID has affected the entire world, so we absolutely agree over there. But if you notice in some countries of Asia, and I'm talking about Thailand, I'm talking about Bangladesh, as well as possibly India, just as some of these examples. But the survey that we did showed that the food system actually had collapsed for a while, simply because the value chains, people were not able to access food because of the lockdown. This was true of all countries. So this was a big problem that people could not access, forget healthy foods, even normal foods. So as a result, people started buying dry foods, bread, foods which were energy rich. So this affected their diet. Number two, there was a lot of psychological impact, socioeconomic impacts. People had lost jobs. So there was an impact on the poorer, resource-poor households. Now, because they were housebound and in cramped areas in cities where walking or exercises were not possible, there was absolutely, people started sitting at home, and that also resulted in weight gain and, because of the lack of exercise. However, the more important point was food insecurity rose in some of these countries that I mentioned simply because people were not able to access the foods. There was a case of hunger. The number of meals that people took also were less. So I would say that food security that has been affected is number one. So we need to open up the value chains. And also there are myths. For example, poultry value chains, people were not eating eggs. They were not taking chicken because they thought you're going to get coronavirus from the chicken. So some of these big problems were there. Now, a point on nutrition. I believe it is important to have adequate nutrition education from online sources because this was the time where a lot of misinformation was going. Focus on protein-rich foods, zinc, vitamin C, micronutrient-rich foods, as well as vitamin D with reference to some exposure every day with the sunlight. I think these were important. Now, here I would also mention that we must valorize the importance of traditional foods and fermented foods. We talk about probiotics. So foods like curd, foods like, sauerkraut in Germany that you have, there are equivalent foods this side where you have pickling, then sprouting, germination. These traditional practices can be improved, can be promoted, and this will give you your B complex and other essential foods for your gut health. I think some of these were being promoted. And of course, dietary diversity, but the biggest problem was income, which was impacted, and the value chains. So my message is we have to promote nutrition education, not that it's going to, cure coronavirus, but it will give you resistance against infection across the age groups that we are talking about. Thank you.
Thank you very much, Professor Marcos. We finally have been able to connect with Professor Prakas. Will you keep the question for later? Now it's time to welcome Professor Prakas from India. He is Vice President of IUNS and also President-elect of IOFOS. Therefore, is a very relevant representative of the ASEAN community in the area of food production, food availability, food distribution. Welcome, and we apologize for any inconvenience you have suffered. Please, you have 10 minutes for your presentation. Thank you.
Yeah. Thank you, Alfredo, and hello, Lalita, and hello, Marco.
Yes, hi. Hi.
Wonderful.
He's an old
my
friend.
camera is not working, but I will be on audio. Hope you are able to hear.
Yes, we can hear you very well.
Wonderful.
That's good.
So let me address quickly in the time period of 10 minutes. I think the role of food science, food technology, and nutrition is not different. They're all having the same goal. And sometimes it is nutrition, sometimes it is food science, sometimes it is food technology with appropriate, available, affordable, and accessible food to the masses. When we look at a holistic approach of life from food, on a day like this, on October 16th, is the World Food Day, we still have many things happening in the world which apparently are uncontrollable. The countless deaths due to hunger and starvation, even in the normal days, is much higher than one can imagine compared to the situation now along with COVID-19. Pandemic in Africa and many other regions of Asia and many other regions of the world, which was supposed to be at one point of time very, very different, are all in the same boat today. The pandemic has struck all of us equally, and food has become a fundamental point of the consumption for immunity till the vaccine comes. We cannot really do anything else except build our immunity through food. And this is very important. And that's where the food systems that have failed to deliver many other deliveries, perhaps even the poorest of the poor, can get immune systems triggered by a certain foods that they eat. So this is where the importance of traditional food, ethnic food, and all the foods that one is eating over lifelong for their prebiotics and probiotics play a very big role today than ever before. This is a very sad opportunity, but it's an opportunity for nutritionists to show here it is what happens to immunity, which was never too much of a subject to nutrition. It was always undernourishment, malnourishment, obesity, the child, adolescent under stunted growth, the women in the area of both nursing and and also
Exactly.
the anemia. But today, there's another dimension of nutrition that is basically immunology. So immunology has become a subject of nutrition never before thought of so much. We have been speaking, we know the micronutrients, we know zinc, we have vitamin D in our platform. But today, along with nutrition, as we know, food can reach different parts of the body only through not as food but as biomolecules. In these biomolecules, not only vitamins, minerals, and to a certain extent protein, calories, and also fat, but also other nutraceuticals from spices is a combination today of the merging and consolidation of, on the one side, the other things which were never thought to be playing a role in nutrition and also in immunity have all combined together to one force. And that is something very, very different today. So, therefore, when we talk about nutrition, we are today talking about nutritionals, basically. In IUNS, the word International Union of Nutritional Sciences, it's a very peculiar word, nutritional. So, therefore, it combines many other things. I would say when we look at food habits of each country, the immunity pushing habits of traditional wisdom and practices, along with exhausting mental and physical strength after fighting hunger and starvation, especially in the African continent and some of the Asian countries, it's a big challenge apart from plant based indigenous medicine, but also adapts to self immunity. So, therefore, it is very, very important when we talk about region and nutrition. Nutrition may be one single science globally, but when its application to human comes, it is region. And that region cannot be forgotten because the microbiota of each region is quite different. So, therefore, it is vital that science is common, but application is different. We need to recognize that today forever than ever before. Many countries have this risk of tradition being forgotten. So much of rich tradition, and the human body has mostly seen one vaccine or two, like smallpox or BCG. But the individual immunity is what boosts the natural immunity provided by good nutrition, which is met on a daily basis. And I want to remind on this World Food Day, nutrition is not a vaccine, it is a daily dose. Beat the daily dose. And vaccine can be once in a lifetime. But nutrition is a daily dose. And we can't say we gave somebody one meal and it's all done. So can you give the next meal? Can you give the next meal? And so on and so forth. So therefore, building body immunity appears to be the strongest agenda today till the vaccine comes. We can't be keeping quiet. This is the time for nutritionists to be 24 by 7 active and make sure everybody has boosted the immunity with exercise, with mental exercise, adequate food. But then again, poverty, starvation. But we have a very important, my last portion will be a very important point of there are sets of people in any population who are probably younger, who are much more immune, but at the same time, the pediatrics and the geriatric levels really have to worry about the amount of food that they can eat, the amount of immunity that they can get is not kind of unlimited. They are restrained for many reasons of the old age, and therefore, how do we really build immunity in such cases? So this is where certain biomolecules and also certain functional foods have a very great role to play. And this is again regional and need not be global in the sense what is fit for one may not fit for the other. For example, if a person is used for rice and fish throughout life, and without that, the body won't react very well. Mentally, he will not be satiety at the end of the dinner or lunch, whatever he can get. So therefore, when we look at the clicking of the time, which is going down very fast today in terms of COVID numbers, I think it is, we not only have to play a very important game in nutrition of undernutrition, poverty and hunger together, but also other molecules which contributes to the immunity is important, especially plant-based foods. And these plant-based foods have more than 3,000 in varieties in the world. And I think these have to be distributed, whether it is Chinese traditional medicine or Indian traditional medicine, or Bangladesh traditional wisdom, or even Nepal, Himalayan, region, or the African region. Each country in Africa has different traditional foods, which has a different immunity boosting to the body and protects the body from a very different level. And therefore, I would say in the end, this sentence, if hunger and starvation does matter to us, we shall matter more to it by networking the networks through modern communication technologies such as this, which I was really struggling with the group of Lorena and Sheila to connect you. It was a marathon task, but congrats to them. And 100% of what we are doing, the corona, we want to ward off. We have put all our efforts together to ward off corona. It is only that spirit, if the world moves, there is hope for starvation and hunger to be out. Let us also think, along with corona, COVID-19, starvation, hunger, undernutrition is another pandemic that if we join together hands, we can have a vaccine. And that vaccine is within us. And COVID-19 virus has made us realize how insecure we are on an hour-to-hour basis, day to day, with home, with money, with food available in plenty for the rich. But the story on the other side is the pangs of hunger and starvation are worse than COVID, as it is not known when the next meal will come or will it ever come in the future. So I would like to end my talk by telling with a question that remains with me is, where is the vaccine for hunger and starvation deaths for the poorest of the poor in these most difficult times and also in normal days? I am talking about non-COVID times. Let us begin today. My confident optimism says that this can be done provided we act locally and think globally, and also global action to come to local levels and the local problems to be hosted online for rapid communication. And what we need is people to work in the ground. So therefore, this message on a World Food Day today is something which really bothers me. And I hope this message will be with us when we eat every breakfast, every dinner and lunch. How many other children have access to even 1/10 of what we are eating? So that is the passion of science with the compassion of society for the underprivileged and the needy. Thank you very much. I hope I have stuck to the time, Alfredo. Hello?
Dame salida. Thank you very much, Prakash, for keeping the time. I would like that Professor Marcos have a small summary after she was removed from the stage. Could you just make a point about sustainable diet from the European perspective, please?
Well, I think it's a big concern in all the countries, and well, not only because we have a very big problem right now with the pandemic, something to do with our last life. So I think that we have to conserve and be careful with sustainability, and then to eat well and to avoid any possible situation of obesity, to avoid any other disease. So something to do with sustainability all the time, and to promote life in good conditions, because at this time the conditions are not so good.
Thank you. And also, I would like to give the opportunity to Professor Prakash for a small summary, a take-home message about the presentation he made, but also about sustainable diet. Which is the future? Which is the future of functional foods in the context of sustainable diet?
Alfredo?
The take-home message lesson that I would like to give is very simple. Eat sufficient quantity provided you can afford it of food, and not overeating. Eat varieties and eat what your body likes, not what your tongue likes. Very important. The tongue and body has to be differentiated. Since your inner voice is the gut feeling, GUT capital. And these days people talk about gym, that is going to gym and doing. So my definition of GYM is gut and any practice of exercise like yoga or meditation. And finally, the ultimate point is to keep the mind very stable. I know when there is poverty, you are tensed up, you are very hyper, all that we cannot avoid. But to keep the mind in constant stability is very important, because that can affect the immunity. Lastly, Alfredo, I would say, can we attempt this pathway of making sure we do not harmonize the food habits of the world, but rather specialize the food habits of each region and understand what diseases are prevented over thousands of years by reverse epidemiology, and find out why that food has made that difference and learn from it. The science of food epidemiology and prevention of disease has never been understood. And I think it is time on the World Food Day and a forum like this, that is a message that we all, whoever it is, can join together to understand from pediatrics to geriatrics in terms of how food epidemiology has kept some population fantastically healthy. And we need to understand that habit from childhood, from pediatrics to geriatrics. So therefore, food systems is in food habits and food availability and agricultural availability. Thank you very much.
Thank you very much. I appreciate the effort made by Lalita from Thailand,
we
Ascension
concur
from
to these
Spain.
points, which are very, very critical and relevant for today's theme. I want to emphasize on the issue of dietary diversity, which sounds everybody's talking about it at the production level and at consumption level. But when you actually look at what people eat across the board, we must emphasize on your cereals, your lentils, or your protein foods that you have. But vegetables and fruits should form a major part of your diet. And this is where we find it is not often done. Yes, the vegetables and fruits may be expensive, but there are always local equivalents, local foods, which should be promoted and encouraged. And the point, plus some nuts and oilseeds, which are important source of micronutrients. And in the case of animal foods, fish or chicken, the way that is common to that cultural context. So that 5 food group out of 10, I think we must emphasize during the course of the day that at least one meal you have this. I think if we can do this, which is not that simple, and make it affordable using local foods, I think we would have achieved something in terms of our nutrient adequacy. And in reference to what Accenture has said with the obesity, with the overweight, I think the amount of cereals that are taken, if that can be reduced and if the vegetables and fruits can be increased, I think we'll be able to improve the proportion of food groups which can contribute to both energy as well as nutrients in the diet. I think this is the message I would like to give on dietary diversity is the key.
Thank you very much, all 4 speakers. I appreciate the
combination of what Prakash has said in local foods and what you've said about addressing overweight, because this is a long-term process about overweight and obesity. You don't suddenly become obese.
Thank you very much. Then I appreciate the efforts made by Professor Marcos, from Professor Lalita, from Professor Prakash, and also from Francis Sotor. Therefore, we are just a little bit later than expected, and it's time to open the next roundtable. Therefore, I asked the organizer to present a small video about the next speaker. Please go ahead with the I would like to welcome all of you, Dr. Regil, Professor Allen, Dr. Ana Islas, and then we will try to follow the schedule. The idea is that you have about 5-10 minutes for your presentation. And the first one is Ana Islas. Please.
Hello, good morning. I hope you can hear me well. Hello? I will be sharing my screen. Good morning. Thank you so much to present to the organizers for inviting me to present today on the 75th anniversary of FAO. I am very glad to be here. I hope that you are you all are celebrating today with us. We are very glad to be here. Just to explain that FAO is celebrating today its 75th anniversary, and thus we would like to just acknowledge the organizers for doing this event on this very important date. Thank you very much. So, I would like to present to you the food systems and approach to promote healthy and sustainable diets and better nutrition. And we heard this morning a little bit about different aspects of malnutrition. We heard from Dr. Marcos the issues with overweight and obesity. I would just like to go a little bit back and explain a little bit what do we find as issues that we have on hunger and malnutrition. In the 2020, earlier this year, we present FAO and sister agencies launched this publication, the Food Security and Nutrition in the World document, the State of Food Security and Nutrition in the World document, which we call SOFI. And data from that publication show that globally in 2019, about 690 million people, about 9% of the world population are undernourished. Also, food insecurity is very, very high. About 2 billion people have either severe food insecurity or moderate food insecurity. Children under 5 still at great rates present stunting, wasting, and overweight is increasing. We also have other issues like low birth weight and micronutrient deficiencies. So at the same time, we have widespread inequalities, poverty, lack of opportunities. Environmental degradation threatens life as we know it, and so we have issues with greenhouse gas emissions, land, water pollution, resource depletion, and loss of biodiversity. And we have social pressures that are mounting, for instance, migration and conflict. Therefore, all the countries that endorse the Sustainable Development Goals, we are trying to move countries towards improving sustainability in all these different areas. And one of the approaches is with food systems approach. Food systems, we heard it already today from Dr. Prakash, must change. They are not delivering, they're failing us. They're not delivering affordable, healthy diets to meet our nutrition needs sustainably. We as consumers also have our part to play. But food systems, one of the major reasons for the heavy burden that I just showed you of hunger and all forms of malnutrition is that our food systems are not responding to our needs. But consumers, we are also part of this food system, and therefore we need to act. So what do we mean by a food system framework for diets and nutrition? This is a diagram that was adapted from the diagram presented by the high-level panel of experts in 2017 in a report called Nutrition and Food Systems. But if we see this, our diets are born from food systems, basically. Food systems influence the type of food produced and the nature of their journey from farm to fork. They are meant to provide food that is healthy, that is sufficient in quality and quantity, affordable, safe, and culturally acceptable. However, something has gone wrong, and what we are left to is with a high burden of malnutrition and other outcomes that are not building and giving us what we need. So food systems are increasingly seen as both an entry and an advantage point for achieving multiple objectives of the SDGs, because they gather all the elements and activities that relate to the production, processing, distribution, preparation, and consumption of food. And the output of these activities, including economic, sociocultural, nutrition, and health and environmental outcomes. Food systems influence the types of food produced and the nature of their journey. That's one thing that I would really want to stress. So what can be done? If we want to improve food systems, we have several entry points. For instance, if we look at improved food environments, and we heard earlier today from Dr. Sotor about food environments and about food availability that consumers are presented with, these food environments allow consumers to purchase and consume more nutritious and healthy foods if we improve them. A substantial body of research describes food environments in high-income countries, but we don't have that much information in low and middle-income countries. Policies and programs are focused on food environments that have been implemented worldwide, including approaches aimed to improve access to nutritious and healthy foods in food deserts, provide healthy options in food establishments, and promote healthier diets through motivating and supporting consumers, regulations, standards, taxes, subsidies, trade policies, labeling, and advertising. As you can see, the figure depicts the way in which the food supply chains interface with food environments and the potential impact pathways that orient consumers towards improved diet and nutrition. As you also, there are three main pathways. One of them by increasing consumption of nutritious foods, by decreasing consumption of less nutritious foods, and third, by generating income, which can enable consumers to purchase more nutritious foods, all building towards healthier diets. So from the consumer standpoint, economic constraints, choice architecture, information swamps, like lack of opportunities to develop agencies and skills, and the resulting lack of demand for foods congruent with healthy diets are also critical factors. So FAO and WHO collaborated last year to look into what are the guiding principles for sustainable healthy diets. Sustainable healthy diets then must combine all the dimensions of sustainability to avoid unintended consequences. Sustainable healthy diets promote all the dimensions of individuals' health and well-being and have low environmental pressure and impact, are accessible, affordable, equitable, and culturally acceptable. In that sense, FAO's work on food systems, as we heard earlier today from Dr. Bhattacharjee, She presented excellent examples from Asia and Bangladesh of the type of work that FAO does. I would just like to highlight areas where we are working. We work on policy, governance, data, and evidence, for instance, dietary diversity, food consumption, food composition, situation analysis, food systems for nutrition, value chains, for instance, procurement, food loss and waste, school food and nutrition, behavior change strategies, including food and nutrition education, capacity development, and much more. Finally, I would just like to highlight this food systems dashboard that was recently launched. You can visit it at Food Systems Dashboard. It provides country profiles that include data for food systems, food environments, individuals, diets, and others. Thank you very much. And here are my contact information. Thank you.
Now I would like that the next speaker has time just to present their own slide and the message she wishes. Thank you very much, Dr. Luz María de Regil, for accepting this invitation from IUNS. Thank you.
Thank you very much. Can you hear me well? Okay, perfect. Thank you. I won't share the screen, but I was asked to talk about policy and programs in 5 minutes to manage undernutrition. So I will start first for thanking the organizers for convening this event to celebrate the World Food Day, and also congratulate my colleagues from FAO on their 75th anniversary. Really a great journey in the United Nations system. And thank you also to the audience for joining. I have seen the complete list of speakers, so I know that you will have a very thorough learning throughout this session. The list is remarkable. And as I said, I only have 5 minutes to make my point, so I will try to leave you with 3 clear messages. The very first one is that COVID is a critical juncture for malnutrition to really improve the work for nutrition. Second, that there are concrete policy actions and that can influence programs that can be done now. And the third is that there is global momentum and we all need to join the conversation. So let me start off why I think that COVID is a great opportunity to address malnutrition. Clearly, the pandemic has changed the way we see the world in the last 10 months. As it was described in the previous session, the pandemic has caused a lot of disruptions in the health and in the food systems. In the health systems, it's clear that there is no the attention to maternal health, to maternal nutrition, to nutritional care, to the treatment of non-communicable diseases has been reduced considerably. Almost all countries report disruptions in that area. But also in the food systems, there has been disruptions in the supply chain, new challenges to trade. Many people are looking at local markets as a new alternative rather than global supply chains. And with the lockdown, we are seeing 2 things, 2 very clear things. Undernutrition, that is wasting, particularly, is going up. We estimate that 14% more, that wasting will increase 14% in the next year. That means around 6.7 million additional million children that are suffering from wasting. The second is that with the lockdowns, people are staying at their homes. They are stressed and probably they are overeating because of that stress. Livelihoods have been affected, so the procurement of food has been challenged and families are eating less affordable foods. And it's very likely that we are going to end this pandemic with more overweight and obesity than we had before. As we know, both undernutrition and overnutrition increase the disease, the likelihood of dying from COVID, but also the illness and disability from other conditions. So when we are talking about food systems, I have received that feedback from many people. We still think that the narrative is a little bit too vague. It's what does that mean? And what I want to give you is the message that we can do something. There are concrete actions that we can do to improve our food systems. I truly believe that we can help families access healthier and affordable diets, but also we have to be realistic. We can do short-term things, but also we need to have a long-term vision because the changes are not happening from today. And in a time when we want everything to happen like this, it's more challenging. So in July, WHO, WFP, FAO, and UNICEF produced a statement, a call to action to protect children's rights in the face of nutrition, in the face of a pandemic. And they proposed 5 concrete actions. Promoting access to affordable diets, and Anna has talked about it, improving maternal and child nutrition, reactivating and scaling up services to prevent and manage wasting. Wasting was a little bit forgotten, and we have to scale them up because it is going up. Maintaining school feeding programs. It doesn't matter if children are going on or not to the school. In many cases, children, that's the only meal that they receive at school. So we need to improve the supply. We need to keep the supply of foods to those children. And of course, expanding social protection programs. Before the pandemic, around 40 countries, I don't have the exact data, had social protection programs. Last month, 194 countries had social protection programs. That means that that's a unique opportunity to address malnutrition, but also a duty to improve the livelihoods and the way that people are eating. In that same line, I will just share that, and I'm happy to share the reference through the chat if the organizers would like me to. But the UN Secretary produced, the General Secretary produced a policy brief called The Impact of COVID-19 on Food Security and Nutrition. And again, you will find concrete actions and policies there. The very first one is mobilize now to save lives and livelihoods. We cannot, and it's very difficult to say, let's improve the food system or the diets of people if we do not improve the livelihoods of people. For that, we need to make sure that we designate food and nutrition services as essential, that we protect the health of food workers, of course, keep the trade corridors open, and expand monitoring systems. And also, he calls to invest in the future, as I was already mentioning. As a nutrition community, there is a way of advocating to make sure that funds that are in the COVID response also respond to the nutritional needs and in ways to improve the food systems. And there are several approaches. The One Health approach, where it takes into account the human conditions, but also the zoonotic diseases, is a good way of doing the things and making sure that all the stakeholders are taken into account. As I said, I'm happy to provide the references if you would like me to. And the last point, before finalizing, I'm conscious of the time, I want to say that next year, the UN will organize a food summit for food, the Food Systems Summit. The date is not set yet, but what I want to tell you is that a lot of countries, a lot of actors in the food systems area are coming together. We will discuss next year with a great global momentum how to ensure access to nutritious foods for all at all times, shifting to sustainable consumption patterns, boosting production and nature-positive production at sufficient scales, advancing, as I was saying, equitable livelihoods and value distribution, and building resilient communities and food systems, because we know that they are very fragile. The fragility is there. So in summary, again, my 3 key messages is COVID is a critical juncture that makes more evident the role of malnutrition in all these conditions and the importance of keeping the food systems function and delivering healthy food in a sustainable way, but also opens opportunity to improve the food systems. There are already clear guidance to improve the policies and how we design our programs to ensure that people eat sufficiently, and that we also give messages to reduce the likelihood of increasing obesity and overweight in the next years. And of course, the invitation is there. Join the global conversation. there are Twitter accounts, LinkedIn accounts, a lot of conversations in social media. So join the conversation, because it's together. Only if we work together is we are going to shape the food systems. I will stop here, and Alfredo, over to you.
Thank you very much for your very nice presentation. And now I am very, very pleased to introduce Professor Lindsay Allen, former Vice President of IUNS and real prestigious scientist around the world. She has been in America, in Europe, and also in Latin America. Therefore, is a relevant speaker in this context of the FAO Day. Thank you, Lindsay, for accepting our invitation. And then the micro and the video is yours.
Thank you very much, Alfredo. Thank you, IUNS. And I'm very pleased to have this opportunity to talk about this very neglected topic of harmonizing nutrient reference values for populations. So this is a figure which explains what I'm talking about here. The terminology for nutrient reference values at the moment varies across countries, across groups, across governments, and so on. But most of you will recognize the RDA or the RNI, which is what we call the individual nutrient level. And the RDA is supposed to be used for planning and evaluating the diet of individuals, not population. The two values that are really needed are the average requirement. In the US, they call it the EAR. In the EU, the AR. So average requirement. And that is needed to evaluate and plan population intakes. It's the average requirement of the population for each nutrient. The other level, which is important, is the upper level. And this is particularly important when we're talking about food fortification, because we want to avoid intakes that exceed the upper nutrient level in any case. So what is wrong with the available nutrient reference values? Well, they're very important. We use them for everything: assessment, education, planning and monitoring, nutrition programs, food-based dietary guidelines, food programs, planning food fortification, research investigators, food labeling, and many other purposes. But the actual true fact is that many countries and agencies have either no ARs or ULs or few of them, including WHO FAO, which has some of the tables which are most used, have no ARs and very few ULs. And so instead, countries and agencies are evaluating their food situation and nutrient situation, their national surveys and so on, against RDAs or RNIs in WHO FAO terms. But those exceed the requirements of 98.5% of people in a sex age group and substantially overestimate the prevalence of nutrient inadequacy. So I think, is my opinion, that having ARs and ULs available to able to appropriate assessment of intake adequacy and safety is so much more important than the efforts which many organizations go through, which is to fine-tune existing RDAs or NRIs or NRVs every 5 to 10 years. Huge amounts of money, huge amounts of time, and for very little value, my opinion. And it's unlikely the gaps that we have in those will be filled by more science, because there are reasons why the data don't exist, like they are needed for young children, and we can't do the kind of research we need on young children. So the cost of doing this and more systematic reviews, which are seen as important these days, of everybody redoing these, is really prohibitive. Millions of dollars it can cost, and there's little point to redoing everybody else's system. So the National Academy, originally sort of the IOM, Institute of Medicine, we talk about is the same group, have recently published a book, consensus study report, international, people from Europe were on the panel, to describe a generic method for developing NRVs. And the focus is on how to set an AR and a UL, and those are the values we must have. And there's a toolkit coming out as well, which describes the generic resources that are needed. So much is similar across countries and regions. What are the available systematic reviews and databases? What are the very few local or regional factors that affect requirements? Bioavailability from the diet for 2 nutrients is one of them, infections, and so on. So they lay out some choices when setting recommendations. Do you want to derive a whole new set of NRVs, modify some that you have already, use existing NRVs published by the IOM, and EFSA does use this system, European Food Safety Authority, so there are values there. But they have many holes in them. They still don't have AIs, ARs, and ULs. Or we set out recently to produce a set of harmonized nutrient reference values for populations. And so for many nutrients now, we have produced ARs and ULs by combining with scientific thought the values from EFSA and from the Institute of Medicine. I think it's entirely justified. All requirement recommendations are uncertain at best. They vary among individuals. It's unlikely actual requirements vary much across population groups. And using NRVs to assess or plan population intakes relies in the end on very variably accurate food composition data in any case. In other words, a huge amount of fuss and precision about these values is not justified. And finally, programs are going on, and these NRVs, harmonized NRVs, are needed. For example, Argentina is going to use them in their new National Nutrition Survey. So finally, we have a lot of values now. 25 nutrients have HARs, harmonized ARs. They're based on all of those expensive reviews done in US, Canada, Europe. They can be used for many purposes now. Countries can set their dietary guidelines based on these values. They can change these values or whatever, but I think they're going to use most of the values that we are proposing. And we do still need, however, endorsement of harmonized values by global authorities. So in summary, we're hoping that this is the start of a process that will reduce redundancy in countries setting their own values, can increase the consistency, allow progress without massive funds being invested, more timely updates instead of waiting every 10 or 20 years, and better understanding of how they should be used and applied in evaluating food systems. Thank you very much.
Thank you very much for keeping the time. As you know, this webinar needs to be active, and then in order that you can also give another view, I will ask Anna ask a question to Luz Maria. Luz Maria ask a question to Lindsay, and Lindsay made a question to Anna. The only thing is just to make clear that we have not much time. Then please, short question, short answer. But Anna ask Luz Maria asks Lindsay asks Anna. Okay, thank you very much.
Thank you. Well, first of all, thank you, Luz Maria, for the congratulations, and thank you also for pointing out that COVID is very, of course, it's a shifting point now for nutrition. I totally agree, and we're glad to be collaborating with you for policy briefs and things like that, and rely very much on WHO's guidance for that. My question is, in terms of the work that WHO is doing for food systems and nutrition, where do you see the role of WHO?
How much time do I have to answer that one?
I would say 1 minute question, 1 minute answer.
Okay, so I will be brief. For WHO, the food systems, the way we are approaching it is a matter of health. The way that we need to eat healthier food because it affects our health. As I was saying, we can no longer think that food systems are in one direction and then health systems in another direction. COVID makes us think that we have to align better the health systems and the food systems. So the way in WHO we see it as an opportunity to align two things, the food systems and the health systems, to build partnerships for health related in the food systems area. We certainly have a platform to advocate for healthier diets and promote the work of our partners. And of course, the normative work is extremely clear, right? So we need to have a thorough and tough conversations in terms of food labeling, in terms of marketing foods for children and for adults. We need, and WHO is a strong agency to provide that guidance. So I think that answers your question, but I really want to make the point that our job here, because of the complexity of the challenge, is not a problem, it's a challenge. It's about building partnership for health and all the things related to food. Thank you for the question. And Lindsay, it's always a pleasure to see you. Long time no see, so of course you are a mentor and a nutrition hero, I will call it, for many of us. So my question for you is, what is the rollout plan for all these values that you have presented? How are you sharing it? How are you? Are there plans for translating it into different languages to improve the reach? Yeah, it's basically about rolling it out.
Yeah, that's a really critical question. I say the plan is ongoing at this point. The National Academy wants to take on more the implementation of the guide for setting NRVs, including the toolkit. And I think they will be another year or two trying to do that implementation. I would really like to push our harmonized values, but I really think that WHO and FAO have to endorse those. And I would be most appreciative of a suggestion as to how to do that. We were nervous about involving those agencies right at the beginning because this has been going on for about 10 years. And it started with WHO, actually. And the slowness of the situation and the big need for these values drove us to develop and publish what we could call a preliminary set of values. And I would really, really appreciate scrutiny of the values and some endorsement from your agencies. And I would love to be able to talk to you about how to proceed with that. I think a lot of the push will come from countries themselves as they start to use the toolkit and also the harmonized values as well.
No, it's certainly a conversation that we must have.
Good.
Thank you, Lindsay. Can you just ask a small question to Anna?
Oh, Anna, what do you think of my suggestions? What is FAO doing now? I mean, I do know somewhat in terms of the values that you use to for nutrition planning and evaluation?
So Lindsay, thank you. No, we appreciate very much the work that you're doing, and as Luz Maria said, we really, you're an icon, and we appreciate the work that you on the reference values. In particular, the area that I work on, we support countries in development of food-based dietary guidelines. So definitely that we are revising the methodology right now, and we will be very glad to talk to you about how to integrate what you're proposing into the new methodology in particular. But in a broader sense for endorsement, I don't know exactly in FAO language exactly what that means, but I don't think it is the possibility. I think it can be integrated into the support that we provide to countries as a way forward in a more technical way.
Right.
So that could be the way to go.
If they were used, that would be an endorsement.
Thank you very much. I appreciate very much that finally we are finishing by smiling and laughing. Thank you very much. Then I will ask if Paul Amuna is there. If there's there, please, you have a minute for a take-home message. If you are online, you will have a minute and a half. Then go ahead. Paul, can you hear us? Okay, then unfortunately, we are having some problem with Paul because he is not able to listen us. Therefore, I am going to give the micro and the audience to the following speaker, whose chairwoman is Dr. Ana Ramirez. Thank you very much, Luz. Thank you very much, Ana. Thank you very much, Lindsay.
Thank you and good luck with the event.
Thank you, Alfredo. Thank you very much. Thank you for the invitation. Thank you.
Hello to everyone again, and welcome to the session of nutrition. I would like to read you some recent data on 2020 from FAO report, which notes that before the pandemic hit the globe, almost 10% of the world population were facing severe food insecurity. The worst-case scenario predicts up to 828 million people to be undernourished in 2020. 132 million of them could suffer because of the COVID-19 pandemic. So all actors involved in ensuring healthy and sustainable nutrition are committed to raising awareness and establishing global commitments and actions that will transform food systems to solve not only hunger, but also to reduce diet-related diseases. And this is the table that we have from now with these experts that we are going to hear about the state of food security and nutrition in the world. So we have with us Professor Alfredo Martinez, Joao Rodriguez da Silva, and Linley Tuona that are going to speak about these cases. I am not sure if Professor Linley is here, so we're going to start with Professor Joao Rodriguez da Silva, Program Manager for Nutrition, Physical Activity and Obesity at World Health Organization in Europe. Please, Professor Joao.
I hope you can hear me. I'm trying to share my screen. Okay, Thank you very much. I'm really delighted with this opportunity. I would really like to express my gratitude for this invitation. This is a very important day for those who work in nutrition, the 16th of October, always. And as I was asked, I will cover during approximately 10 minutes some of the issues that we are facing, particularly in the WHO European region, because it's the region we are responsible for. It includes 53 countries. This European region, which is the biggest globally in terms of number of countries, and it covers all the EU member states, plus all the Russian-speaking countries in the European region and beyond, Central Asia. So the challenges around nutrition, food and nutrition are quite different, and it's a very diverse and heterogeneous region with, as I said, very different challenges depending on the place where we are in this region. It also covers a lot of ground, just the Russian Federation, which is where we are based. The regional office is based in Copenhagen, but our office, which is mainly focused on NCDs, is based in Moscow and supported by the Russian Federation. And as I said, only there you have 11 different time zones. So you can imagine how really complicated it is to address such a variety of food and nutrition issues. What we have in common is that we are all addressing and trying to achieve sustainable development goals. Nutrition plays, and food and nutrition plays a role in all of them. This has been identified, but particularly Sustainable Development Goals 2 and 3 are very important. And we deal a lot with Sustainable Development Goal 3, where in fact the dietary factors have been identified as very important to achieve the objective, sub-objective 3.4, which is really related with NCDs, with the non-communicable diseases. And it's very interesting because as we move forward and we do actually more in terms of non-communicable diseases, which are somehow the result of unhealthy behaviors like smoking, alcohol, physical inactivity. There's been significant progress around, for example, tobacco and alcohol, and that progress makes diet more and more important because proportionately, if you look at the global burden of disease and also other estimates for our European region, which you see, of course, you can see on the top right-hand side of the screen of your slide, and there it's very clear that many countries in the European region have a very high burden of non-communicable diseases, which is also related with diet, and of course diet-related diseases are very, very important and proportionately becoming more important in the WHO European region. On the next slide, actually, I have even more detailed, so going a bit in a deep dive in terms of the situation in the European region, where I would like to show you the premature mortality in our region, where of course it's still very high, and although a lot of progress is being made, and progress is being made particularly in those countries which were lagging behind 1 or 2 decades ago, but still a lot of work to be done around particularly the risk factors of non-communicable diseases, where diet plays a very strong role. So what I would like to say here is really, without moving fast in changing diet-related behaviors, without accelerating action, is very difficult to achieve really the results we would like. This is clearly what you can see in the next slide, which is a sort of representation of the global burden of disease, again, risk factors for the European region. And here you can see that although tobacco is still very significant, a leading cause premature mortality and the burden of disease in our region, we see again, as I said before, dietary risk factors coming up and emerging as more and more important. And you also see that blood pressure is very important, IBMI also very important. All of these, of course, interconnected as well with diet. So certainly food and nutrition, very important in the context of health and achieving the health-related sustainable development goal, and that is absolutely very critical. So we like to say that without really addressing decisively the issues of diet in the European region, we are not going to really achieve the objectives we are looking for. So in this next slide, you see that approximately half of the countries in our region, as based on our predictions, and if we continue business as usual, they will not achieve the sustainable development goals, so the 3.4 I was referring to, related with premature mortality. And many of these countries actually within the group of the richest countries within the European Union, in fact. So either we accelerate, and this acceleration is very much depending on what we can do on diet and the relation of diet with cardiovascular diseases, with diabetes, with obesity, with cancer, and also with others. So a different way of representing it, the reds means that we are not going to achieve the targets in our European region, and you can see that targets like the one related with obesity and salt consumption are still very resistant, and we are not moving as fast as we would like. And why is that? Well, because probably countries are not taking action to the full extent. They are making progress, improving, but there's clearly a need to scale up, to accelerate, to really move faster towards the achievement of the sustainable development goals in the area of food and nutrition. In this slide, I have basically an illustration of progress from 2015-17, and we already have new data actually from 2019 in terms of policy development. You can only achieve results in terms of burden if you improve, of course, new policies. And you can see many reds, and let's say the share of the bars which are in red means that countries are not taking action at all, or they're taking action which is not sufficient, which will be amber or orange. And you can see that, again, still a lot to be done, and in some cases we are even going backwards. I don't go into the detail of the policies, but overall, what we would like to say that there is unfinished business here. We have global and also European framework policies. In Europe, we have a new European program of work in terms of health for the regional office, with which our Food and Nutrition Action Plan, which is running until the end of 2020, and is already somehow being extended in terms of trying to cover the gaps, the areas which have not been fully implemented, and there are many. And this Food and Nutrition Action Plan basically has 5 pillars, as you can see in the slide. One really important is healthy food and drink environments. We're also looking into, nutrition, better food and nutrition through the life course, the role of health systems, better data, and also, of course, working across sectors, because this is obviously an area which requires multi-sectoral action. From our office based in Moscow, we're trying to support member states. We work focused on the countries. It's a very young and diverse and large team. We're about 30, many of us working around nutrition. In fact, last year we received the award of the DG for the European region best team. So one of the areas we work with is really on data, and so we have data from surveys, for example, STEPS around risk factors for NCDs, but we have specific data around nutrition, like the Childhood Obesity Surveillance Initiative. So if you are interested, you can look at more. You can look at our websites and get more information. We are also providing and collecting information and providing support to countries to better know the prevalence of dietary intake, let's say, of nutrients and foods, which are very prevalent, particularly in the eastern part of the region, and therefore looking into sugar and salt and trans fat in places where we didn't have any information just a few years ago. And then again, developing tools to support member states on salt reduction, on trans fat elimination. We are going to be the first region in the world to be completely trans fat free. One of our areas is also doing research and implementation research, very much at the core of our business in terms of supporting member states in the area of food and nutrition, using data related with implementation research for really drive action at country level. And also we think we are a powerhouse in terms of providing, and because we are evidence-based, providing and supporting countries with more evidence, therefore with publications. A lot of actions at country level, partnerships with other UN agencies, particularly for Caucasus and Central Asia countries, and lots of innovation around digital marketing, baby foods, collaboration also in terms of sustainable diets, putting our own house in order, trying to promote also better food and nutrition within WHO and within our services. I mentioned our work around digital marketing, and I would like to finish with also with an highlight in our work in terms of healthy and sustainable diets, which is a very powerful pillar where we are now investing, because we received many requests from countries in terms of supporting them to interpret, to best interpret the need to have healthier, but at the same time, more sustainable diets. So this is a slide with just an illustration how we can really save lives if we implement the dietary recommendations, but we would even save much more if at the same time we link with healthy and dietary recommendations the dimension and the component of sustainable diets. It should be done at national and subnational level. So you will hear more from this soon from us, because it's one of the areas we are developing in our work. And finally, also a bit of work in COVID, where we have been also putting the emphasis on the connections with obesity and COVID, and also in terms of food and nutrition and food safety. I thank you very much for your attention and looking forward for any discussion. Thank you.
Can you hear me? Three big ideas we have in IUNS, which means to talk about planetary health, population health, and personal health. At the end, we are talking about sustainable nutrition, we are talking about public health nutrition, and we are talking about individualized nutrition. A few words about planetary nutrition. As you can see here in a very recent paper, association of linear growth and relative weight gain during early life without adult health and human capital in countries of low and middle income. You can see here that the 30 phenotype reveals that children with very low birth weight, they are more prone, they suffer more diabetes and metabolic syndrome. Also, as a view of planetary nutrition, adult height, according to length at 2 years' time, that you know this is a very proxy of nutrition at this year, is also related with the feeding intake in this period. Of course, and very importantly, nutrition and height for age is related to attain schooling. But planetary nutrition is not only concerned with stunting. Planetary nutrition is also related with overweight and obesity. Here you see that is a very high prevalence of obesity, is a very important public health burden, and have impaired quality of life and self-esteem. Of course, hypertension, hyperinsulinemia, dyslipemias, diabetes, cardiovascular disease, inflammatory disturbances are related with this situation, and unfortunately, also with mortality. All of you are familiar with this illustration. When you have a high BMI, your mortality rate is in high risk. Also, physical activity, we know that is a predictor of avoiding childhood obesity. Sedentarism and watching television is predictor of childhood obesity. Sugar, sweetened fat are related with childhood obesity, and the family history is also related with childhood obesity. There are many causes of obesity at planetary level. You can see here sedentary lifestyles, television watching, car driving, the calorie snacking, portion size, eating out of home, westernized dietary pattern, soft drinks, fast food, diet low in fiber, etc. Some example: increasing portion size, sedentarism, portion size, changes in physical activity patterns. You see here the trends are very worrying and concerning from the 50s to the thousands. Also, the number of cars, the number of television is increased in the last decades. The dietary energy density of foods are related with weight gain. The fat consumption and BMI are related. Specific foods like potato chips, processed meat, butter, sweet, refined grains, cheese are related with obesity, while fruit, low fat, and skim meal are related with low rate of weight gain. Soft drinks are related with weight gain. Fast food is related with weight gain. Snacking is related with weight gain. Eating away from home is related with sleeping hours. Sleep more than 8 hours is related with obesity. Therefore, as a summary, of a planetary view of obesity as a burden of malnutrition, sedentary lifestyles, more calories, westernized dietary patterns, no breastfeeding, and lower socio-economical status are related with obesity. Therefore, currently, information is to eat less and to adapt with exercise in order to maintain energy balance and to have a weight status in the adequate level for every person. A second aspect I would like to talk today in the Food World Day is about population health in the context of public health nutrition. We know, and Professor Lindsay has mentioned, that population nutrition concerns nutrient recommendation target to prevent disease and to promote health. Therefore, reference intake are based on epidemiological and population studies to improve health and the general population. Of course, we need to take care, as has been mentioned, individual differences need to be considered as well as high-risk groups for specific nutritional needs. Therefore, we are searching for diet for prevention of coronary heart disease, we look at population level, the role of food included in the Mediterranean diet, like pasta, fruit, vegetables, and olive oil. Some example of population nutrition: fish consumption is related with cardiovascular disease prevention. Olive oil and nuts have been related with insulinemia, has a hypoinsulinemic effect. Omega-3 polyunsaturated fatty acid provided by fish has been related with lipid profile, and also there are many studies relating legumes with cholesterol levels. Therefore, we can talk about different patterns. This is an example that has been published about healthy reference, prudent diet, Western diet, and compensatory diet. All of them are related with chronic disease and obesity. The last point I would like to mention today is personalized health related to individualized nutrition. In this context, it's important to remember that the medicine and nutrition for precision and public health is not a recent issue. As you all remember, Hippocrates mentioned that your food is the basis for your health. Galen, 2000 years ago, mentioned personal attitudes are related with unique response to food. The Arab school, raised Maimonides, but that school also related nutrition with health. Claude Bernard and others spoke about no disease but patients. Mendel, that individualized trait transmission among generation. Therefore, in the 21st century, we have a challenge to use omic science for personalization, for tailor-made diet. It's clear that every individual has own metabolism, where nutrition, physical activity, phenotype, personality are implicated. Of course, genes and microbiota and environmental factors are also related in this individual's metabolism. Therefore, when prescribe a diet, we need to have information about anthropometrics, body composition, energy expenditure, analytical information about nutritional related metabolites, and personal input related with diet, sedentarism, etc. Therefore, personalization involves clear interactions between diet, the phenotype, and genes. We can use this for weight management, but also for treatment of cardiovascular disease, diabetes, cancer, etc. A view of personalization concerning the nutrition and genetic interactions. You can see here there's a genetic influence on dietary choices. There is a genetic influence in digestion, absorption, transport, metabolism, and of course, there are gene and gene interaction concerning the effect on disease risk. Therefore, to take into account all this consideration, it's important to have a view of this context. The advances in genome-wide association studies is providing important information about new loci involved in body weight regulation, in cholesterol metabolism, in insulin and dyslipidemia interactions. In fact, available information is able to understand that, for example, the increase in BMI is related with the risk allele carried. Therefore, there is effect size for genetic variants associated with BMI. Some examples: fat intake affect micro and messenger RNA, after energy restriction. You have seen, you can watch there some example related to different genes. Another example, to be obese can be affected by carrying a specific mutation, but also to have a high intake of carbohydrates. But genetics is not only involved in weight loss, can be also involved in weight regain. This is a, I think, nice example of a pattern to treat obesity depending of genetic information. B carrier of the FTO allele has some risk about 2 or 3 kilos of more in a person, but also we need to have the information about BMI, waist circumference, physical activity, cholesterol level, and glucose level. All this information is very, very important to produce, to generate, to prescribe personalized diet. Also, personalization can generate decision trees. You can hear that taking into account a genetic test, the age, the weight, the initial body weight, the physical activity, we can have a prescription of diet. Therefore, it is becoming evident that age, initial body weight, physical activity are issues that need to be taken into account when prescribing a diet together with the genetic background. Yes, you see that precision nutrition requires to have information on genetics, phenotypical, biochemical, and nutritional input. And also, in the next year, we will be seeing that omics technologies will be of help. My conclusion is that personalized nutrition relies on genetic information, that gene expression and influence by nutrition, physical activity, environmental aspect, and microbiome are important, but at the end, we have that personalized nutrition can inform about nutrient requirements, predisposition to nutrition-related disease, but also for prescription of diet with preventive or for therapeutical purpose. Therefore, precision nutrition involves the consideration of the genetic background, the family history, like and dislike, previous disease, culture, allergies, intolerance, physical activity, and omics. There is not a unique diet. There is an important consideration of different inputs. I would like just to mention, probably some of you have a picture or you can take a note about this questionnaire. This questionnaire has been developed in order to personalize diet. Probably you can just have an idea, NutriIndea 2020.questionpro.com. Those that enter this page will have a personalized view of his or her situation, because with data about anthropometrics, data of nutrition, dietary intake, physical activity, quality of life, perception about food, they have a prognostic situation about the well-being of this person. Therefore, from IUNS, from the personal ideas we have about the Food World Day, we need to consider planetary health, depending on sustainable nutrition, population health, providing precision public health nutrition, and also, at the end, personal health based on precision nutrition. This is my very last question and slide, just to invite all of you to attend the EIUNS ICN 22nd Congress to be held in Japan, the International Congress of Nutrition in Tokyo, September 14, 19, 2021. Thank you very much, and hoping that next speaker, Imort, can join this presentation, or just we can just start with question. Thank you very much.
Hi. Yes, greetings, and thank you very much for the invitation. My presentation today is very different from what Alfredo has, and I really would like, can the organizer please go to the first slide? What I want to share with you has to do with the story of the agri-food systems. And this is when we want to deliver nutrition. This is a World Food Day. So one of the things is to go back to the root of it, where the food come from. When we want to end malnutrition, it is a multi-sectoral approach. So this, one of the aspects that we have to really come to appreciate has to do with agriculture and food systems. Next, please. The role of agriculture is to provide nutrients, particularly, yes, for healthy population, and also we hope that for those who need them. Now, if you take a look at the present situation, we have a gap of nutrients that needs to be filled. But if you can think in the future through a certain program, you can increase the nutrients, particularly from the staple food supply. And during the time when the food price crisis hit, the food supply from staples become very much protected. If that nutrient supply can be increased through agriculture research, then your nutrient gap will be smaller. Next, please. The approach to improve diet quality through biofortification has been talked about, and the team that did this, that pioneered it, received the World Food Prize several years ago for their efforts to increase essential micronutrient trace minerals in the food supply, particularly the staple foods, as well as pro-vitamin A carotenoids in many of the foods in order to address the problem of vitamin A deficiency. Next, please. The biofortified crops that comes from the breeding research, conventional breeding, has been released in 30 countries and also being tested in another 25 countries. Many of them has gone through efficacy as well as effectiveness trials to show their impact on the nutritional status. So this is still an ongoing, but has shown promise in order to bring more nutrient through the food supply. Next, please. If you take a look at the food system, in 2017, the high-level panel of experts of the Committee on World Food Security has published this report, and they have already updated a few days ago. But I like this concept because it shows us the food system are really central to diets and human health. On one side, on the left, you have a food supply chain. Now, from that food supply, yes, from the farm to market, but where does food go after that? The journey of food doesn't stop there, and the environment, which really account for availability, accessibility, as well as affordability, will allow the combined with the consumer behavior would allow them to receive a good diet, safe and nutritious. In order to impact on the right hand side, you would see the nutrition and health. And nowadays, we also need to take a look at environment. So the Committee on World Food Security has just, the high level panel of experts has just updated this concept, and they put sustainability into that. So the food system not only deliver healthy diet, but also sustainability. Next, please. There are many types of food system exist in all the countries, and you can see among yourself traditional food systems, where you still, that's becoming still in some countries are still there, and it's being appreciated. Many people are going back to it, the traditional farm, where they feel that there's a promising future. The mixed food system, which is a mix between traditional to modern food system, where you rely more on supermarket and processed foods. So many countries are in between. I have to say that you can have 3 systems exist in one country, and that dynamism and balance need to be thought of as to how you can make, at the end of the day, your population healthy, and also take a look at the planet health as well. Next, please. How has diets been changing through the years? You may have seen so much that they are changing. We are more urbanized. We have more women in the workforce. So we want to go for, if you can put it up a little bit higher, the slide, please. And you can see that there's a demand for higher value. There's also the demand for some of the food that we have to say people would like to. And nowadays, when you see the disruption, particularly through COVID-19, people are looking at the value, the nutritional value, the health value, health and wellness particularly come on board. 4 key issues I would like to leave with you today. The first one, while we are talking about this, we have to remember who produced these foods for us to eat. And we take a look at that profile and say in the rural populations, the hunger and undernutrition still dominate. And there needs to be efforts to be made in terms of tackling this. Next, please. The rural population do have all over, if you take a look at all the region, you can see South Asia, Sub-Saharan Africa has such a high burden of undernutrition. Next, please. We say at the moment there are urban agriculture coming, but the rural landscape still produce the majority of food around the world. So next, please. As you can see, yes, please keep coming up. Are rural farmers feeding the world? Well, smallholder farmers, the data say, provide 80% of the food supply in Asia and Sub-Saharan Africa, and women comprise 45% of that labor force. Next, please. The smallholders are producing a lot of our food. If you take a look at this, over 50% of the food supply come from them. More than that, next one. They also, not only just quantity, they have more diversified landscape and produce approximately more than 50% of the world's nutrients. This has all been data that published. It's really, the contribution is enormous. Next, please. Next, please. The small farms are the key to nutrient availability. So they produce at least 50% of key nutrients all over the world. And last one. Next, please. Yes, next slide. Yes, this is the last one. So if you take a look around the world, there are lots of successful examples for how rural development can be helpful. It can feed the urban area or populated area if you give them the chance to do that. If you can help them to jumpstart entrepreneurship, to strengthening the technology, and to be able to bring them to the market and empower women and sustain the livelihoods. And we can throw in here too, at this point in time, is to also take a look at environmental factors and say we need this sustainability aspect into the smallholders. There has been a lot of talks at FAO in the past 3 days, and to talk about how the smallholder farmers should be protected. I have given you the reason to do that, and in the COVID-19 pandemics, the impact on them are disastrous. So they are very vulnerable. So this is one of the plea, is to be able to see how we can protect this group so that they can produce diversified food and nutrients. Isn't it a dilemma that someone who brings food to our table ends up malnutrition? Why they are giving us all those nutrients in their food supply? I would like to leave you with that as the food for thought. And thank you for your attention, and thank you for the organizer for allowing me to share this. Thank you very much.
Ya empezamos. Pero yo no tengo que hablar nada, ¿no? Ya entra la doctora. I would like to introduce the speaker for the next session. In first place, I would like to introduce Catherine Geisler, who is the General Secretary of IUNS and is going to give a talk about capacity building. Thank you very much, Catherine.
Good afternoon from here. It's maybe somewhere another time of day in other parts of the world. I understood that this is actually going to be a discussion session rather than a presentation of different aspects of the topic. But what I was going to do a short presentation of was the importance of nutrition education in public health. Now, we know that the poor nutrition, a large percentage of public health issues are related to poor nutrition. That's both for undernutrition and non-communicable diseases. So from this point of view, for all public health issues, nutrition education has to be very important. But who for? There's many actors on the scene. We've got consumers, various aspects of the health profession, both medicals and nutritionists, of course, have to be well trained in nutrition. And then we have the food industry, food producers, children in schools, and even governments to know what policy should be developed. But I understand that this session is concentrating on consumers. Now, consumers are bombarded by many sources of information about new information that's come out from research but hasn't necessarily been validated on how different nutrients affect their health. They're bombarded about health, about diets, what kind of diets they should be having to gain weight or usually lose weight, etc. Now, often this information is unreliable and is not based on good scientific available information. So it's very important that consumers should have reliable scientific information sources. Now, more recently, there are many electronic courses that people can have. And in fact, the IUNS is setting up a system on the website where we have good validated electronic courses on different aspects of nutrition. So this would be one source of reliable information that consumers could get. Consumers have various aids in trying to understand what is nutrition. These are available for them. For example, there's food labeling, but that usually shows, for example, how much of different nutrients are in the different food products that on the food labels. For some of them, they have a traffic light logo. So, for example, they might show very high levels of fat or sugar or salt, or good lower levels, so they can get some guidance from that. Then we have the nutrition recommendations or reference values, and these are produced by the international agencies, WHO and FAO, but also by national governments as to what reference values of various nutrients people should be consuming. However, this information is very complicated and really requires specialist knowledge to make sense of it. And we don't eat nutrients, we eat foods. So it's very important that we have some guidance on what quantities or proportions of different types of foods the public should be consuming. And there's a trend now towards food-based dietary guidelines. And these show the proportion of different food groups that should be in the diet, such as cereals, tubers, legumes, vegetables and fruits, lean meat, fish and eggs, milk, dairy products, nuts, and then the smallest amount, salt, oil, and sugar. And different countries produce these food-based dietary guidelines in the form of either a plate, for example, with different sections shown where you have these different food groups. Sometimes they're shown as a pyramid, so the larger amounts are at the bottom of the pyramid and the very small amounts at the top. There are pagodas or houses or wheels, and different countries use different means of showing this according to their own cultures. Now, of course, these guidelines are intended for the general population, not for specific conditions, which would be treated by dietitians or clinical nutritionists. And in the past, most of the emphasis on policy has been related to the consumer. It's the consumer being given the greatest responsibility for choosing healthy diet. Fortunately, now it's more recognized that we need to deal with the food environment. If the food that's available is inadequate and the prices are too high, if the food is going to cause environmental policies, then it's not just the consumer that is responsible, but all the other parts of the environment, including the government, to produce policies that makes it easier for consumers to have the food available that is healthy for them at reasonable prices. So I think that's a general overview of what I wanted to say about nutrition education for consumers. Thank you. Who is next?
I don't know.
Where is our moderator?
Alfredo. Alfredo? We can't hear you. We can't hear you.
Thank you very much. Can you hear me now?
Okay.
Yep.
Thank you very much, Catherine, for a very nice presentation. Perhaps later we will have some comments from the audience, but now it's time to give entrance to Professor Ordovás. You know him, he works in IMDEA, but also he is professor at Tufts in Boston. He's going to develop a session about nutrients in nutrition with a double perspective, the World Food Day and also from the consumer perspective. Thank you very much.
Thank you, Alfredo. I think, I hope you can hear me. Okay, great. What I cannot do is to show my slides because I try to access through my computer, but it doesn't work, this system. So I am using my phone and I don't have the presentation there. So that's great that we have the plan B. Okay, so I was asked to discuss with that perspective from the consumer, what are the food trends for, this year and the years to come. And next slide. If when people were discussing these things and planning for this year, obviously they didn't have into consideration what is happening now in the world with the pandemic. So these are things that some of them may survive and some of them may not because of the changes in the society that we are experiencing. But basically what you can see here is that if we are talking about the 10 top nutrition trends to look for this year, for this decade, the first one that comes to the mind of everybody is sustainable and environmentally friendly nutrition. This is something that has been embraced by the public, and there has been very, I would say, influential articles published, for example, the one in Lancet that we all know, about how it's important to take into consideration the planetary health, and that involves obviously to take into consideration the environment. So that's from the point of view of the consumer. Yeah, people are looking to purchase foods that they have little packaging. Ideally, it comes from local and social businesses, and I will say that this trend has been accelerated because of the pandemic, because somehow, at least when the peak of the waves, the transport may have been impaired, and so on. So this is, I would say that in terms of trends, or top trends, that comes to number one. Then the second one, that is somehow related, is vegan and plant-based nutrition. No. Go back. Thank you. I went just through point number one of that. So, and again, you see that they are somehow interdigitated with the previous one. Then, something that for us, from the perspective of the nutrition research, something that is very important is personalized nutrition, precision nutrition. And this is something that has been going on for maybe 30 years already, but with very limited support. And it has not been until recently that a series of elements have merged together in order to really bring that precision nutrition to the forefront of nutrition research, but also to the interest of the public and the private sector. And one example of that is the fact that NIH, the National Institute of Health, has launched a huge project focusing on precision nutrition in humans that is going to go through the next, at least in the first phase, for the next 5 years. And there, what they are trying to integrate is large populations, very careful studies in terms of intervention, and also to apply the entire technology, because sometimes we think about personalized nutrition from the perspective of just genetics, but obviously precision nutrition involves much more than genetics. It involves all the other omic technologies, but also it involves a deep knowledge of the exposome of each one of us, our environment, that goes from the dietary environment, but also from the sociological environment, the neighborhoods that we live, the pollution that we have in the environment. So all these kind of things will merge into this area of precision nutrition, which is great, right? In order to make that progress on that. And that will solve with the other issue that comes to the mind of the consumer, which is nutrition confusion. Most of the consumer, yes, even if they are trying to follow the guidelines, they don't really sometimes get good information about what they should be eating. And this is because there is no one size fits all when it comes to nutrition, and that is going to be resolved, at least in great part, by the topic number 3, which is the precision nutrition. The other thing that we have to make emphasis is in the nutrition education, and we have to educate the professionals, the health professionals, physicians, dietitians, nutritionists, in order to be able to adopt this new knowledge that is being brought up by the precision nutrition wave. But also we have to educate the public, the consumer, in order to for them to be able to differentiate what is real and what is just smoke and mirrors. So that will be very important. Well, alternative proteins is a big business because it's also part of this environmental and to embrace this environmentally healthy nutrition. And then obviously we are talking about billions of dollars involved in these plant proteins to substitute the burgers and so many other alternatives. Everybody knows about insect-derived protein, but also the ones that you can produce in the lab. And that's something that during many years it was prohibitive because of the cost, but now things are starting to become to have a cost that is available to the to compete with the let's call natural product, right? Also, people are starting to recognize that, well, you know, yes, it's true. Obesity is a pandemic, another pandemic, but sometimes obesity has been treated like something that marks the individual negatively in the society. And I think there is more recognition that, well, you are who you are, and you have to eat. And the nutrition, what is important is healthy, that is healthy, and it comes with every size. And then also we see a trend towards, I mean, we are all very busy. We want we don't have the time to cook as people did it traditionally, which is a problem. But there are alternatives. There are meal replacements and these nutrients on the go, and you drink something and you have for the day. Do I favor that? No. But this is something that we have to recognize that is out there as a trend for the consumer in the years to come. Ketogenic nutrition is one of these things that is very popular nowadays. And just to finish with this list, for many years we have been in research. The message has been fat-free, because fat was bad, right? Now, as you know, things have been changing, and then we are moving to a sugar-free nutrition, right? Because we consider that sugar is one of the major problems of the current nutrition trends that we have, or we had in the past. So we have to get rid of the sugar. That's what is in the mind of the public. Next. Well, then, as I mentioned earlier, this thing came to spoil our 2020 year, and then we have to go back, next one, to our next. Okay, yes, thank you. So we have to go to our crystal ball and see, well, we have to put in the equation what is happening now and how the society will change as a consequence of COVID, right? Next. And then what we have then, if you ask people now, those trends have changed slightly with regard to what we were seeing in the previous slide that I was showing to you, but you see that they have the same flavor. And this is what we have in these 8 leading edge food trend predictions for next year and for the following year, and is that some of them coincide with what we were saying before. For example, to avoid the sugar. And the consumer now is going to have many different possibilities to still get the sweetness, but without the empty calories that come from sugar. Or even, remember, for example, the time in which people will have to switch from margarine, from butter to margarine, then we have to abandon margarine again. And still the food companies have to develop new technologies to still avoid the trans esterification of the trans fatty acids, excuse me, and still get that solid product similar to butter that people wanted to spread on their breads or whatever. So, for example, Nestle is changing the technology in which they are using sugar, and by decreasing, 30-70% the amount of sugar in a product, people will still experience the same sweetness that if they have the food load, the whole food load. Then it comes, for example, we talk about plant proteins and so on. Garbanzo, chickpeas, is one of these replacements that are now is being used, for example, in ice creams and in cakes and so on, to replace the natural products that you would be expecting, like dairy and so on, from when you are eating this product. CBD, still receives some attention. Climatarians are coming, indicating that people are looking for the kind of products that are going to preserve the environment. So in that, you see the link of what we were seeing before. Exploring foods that were traditional but were not really adapted or adopted by many different cultures globally. Carob is one example of that. So they are being incorporated in the same way that, for example, the garbanzo, the chickpeas. Then, because people have to experience, pleasure when they eat, and you are asking them not to consume sugar, but we all like fats also. So the fats are coming back, and they are coming back in terms of, for example, olive oil, extra virgin olive oil in the Mediterranean culture that has been obviously associated with health. And everything in moderation means smaller portions that maybe, yes, you can still consume your alcoholic drink, but still have less alcohol on it. You can still may have your hot dog and maybe just replace it partially with some plant protein, but it still leaves some of the animal protein there. So it's this kind of combinations, right? And everything in moderation was, for those of you that knew him, that was my mentor, Francisco Grande Cobian, was always preaching in terms of good nutrition. And we cannot forget about the restaurants. And the restaurant, they have also to change how they are providing their services. And there is a reinvention of supplying menus, supplying prepared foods to the customers rather than the traditional service that was eating in. So those are the trends that we see for the next couple of years. Some of them, again, have been a little bit imposed by COVID, but in most cases, you see that there is a parallelism with what we were seeing before COVID. And let's just finish with this kind of longer prediction, which is what will happen in 2030. Next one, please. Next slide, yeah. Okay, so here what we see is kind of bringing all these things together, yeah? We have to take into consideration the demographic trends. There will be more elderly people. We have to think about them. We have to think, again, reiterating the environment. We have to think about climate change. Therefore, we have to bring technologies that are going to have impact in the environment. And as you know, agriculture is one of the major forces in terms of affecting also the climate, sometimes in the positive side, sometimes in the less positive side. We have to look at the geopolitical balance that we are going to find in the world in 2030. Some of the powers are going to be kind of like moving chairs from one continent to another. In terms of trends, we have to return to this traditional, because it's not only what you eat, it's only how you eat it. And we have been conducting studies of thousands of people now in terms of precision nutrition. And what we have come out is that, yes, genetics is important, but the environment that comes with the individual, when we eat, how we eat alone with the family is also important in terms of how we respond to food. So bringing together more this kind of traditional old ways of eating that this has been so traditional in the Mediterranean environment, but also in other places, is important. It's important also to bring to have the food access for everybody, all the different, so we decrease the social disparities, because now, I mean, you go into the States and you find huge food deserts in which people cannot find healthy food. So that has to be part of the movement of the society to decrease those social disparities. And people can find and afford healthy food. Natural food, again, is important. Again, this is part of the trends that have come out from questionnaires, asking people, polls, and so on. And one of them is fusion. And that could be kind of antagonist to what we are saying before about maintaining the traditions. For example, the Mediterranean diet. Okay, yes, we have to keep the traditions, but we have to accept the good things that come from outside. If we go to the, let's say, 1500 years ago, obviously the Mediterranean diet have very little resemblance to what we consider now Mediterranean diet. Now, if we think about the Mediterranean diet, well, we picture as fresh salad and tomato and things like that. Well, the tomato, it was not part of the Mediterranean diet 1,000 years ago because we didn't have it. So many of these things we have to accept and incorporate what is good in order to improve our traditions. And then that is going to also, one of the trends is that the balance between eating at home and eating out is going to be shifted. And there is a potential with, as a result of the COVID, that people will be eating more at home, preparing more foods at home. So that's, I would say that these are the trends that we see in the longer term. And I think I have probably exceeded my time, so I will stop here.
Thank you very much. Now, I would like to welcome Usune Echeverria, Dr. Usune Echeverria, from the Basque Culinary Center in San Sebastián. She is head of the Personalized Gastronomic Unit, and we are very pleased that she accepted to talk about personalized gastronomy. The micro and the video is yours. Thank you for accepting our invitation concerning IUNS celebration of the World Food Day. Thank you.
Thank you very much, Alfredo. I hope you can hear me.
Yes.
Yeah, okay. So I'm trying to share my screen. Well, good afternoon. As Professor Alfredo Martinez has mentioned, I work in the Health and Gastronomy Research Area of BCC Innovation, which is the first world technology center specialized in gastronomy from the Basque Culinary Center. And I would firstly like to thank the organizers for inviting me to participate in this roundtable with top-level experts in nutrition. For me, it's a real pleasure. So just to start, I would like to give you a brief overview of our work at the center. And as you could imagine, as a technology center specialized in gastronomy, our work and research are guided by three main principles, which are our aim to be at the forefront of gastronomy, sustainability, and health. And for this purpose, we have a 360-degree holistic approach of all the gastronomy value chain, which means that in our daily work, we engage with different actors from producers to consumers in order to better understand how the sector is doing and where it is heading. So, of course, this could be only achieved by a common and joint work of a multidisciplinary team that is integrated by researchers in different fields, but also by food service professionals like chefs that have a vast experience and knowledge of food and culinary processes. So as a result of this combination between creativity and science, apart from developing food products and services, we conduct research projects that are directed to promote population's health through healthy and sustainable food and nutrition. So taking into consideration that not only the food we eat, but also how we cook it, how we produce it, and of course the amounts that are lost and are wasted could have an impact on humans' health and environmental sustainability. We believe that collaboration of health professionals and researchers, of course, but also the role of food service professionals like chefs could have a major role when trying to achieve this great food transformation. So for this food transformation, we need dietary modifications. And in this context, we think that personalized gastronomy plays a major role when talking about what we eat and how we eat it. And as Professor Ordovas has mentioned, we think that we need to take into account factors that affect our response to food, like genetics, gut microbiota composition and function, but other factors like sociocultural aspects, food preferences, traditions, that might be barriers when trying to obtain these dietary modifications. So we can't forget that the act of eating may affect or affects the individual in 3 dimensions: physiological, psychological, and also at social level. And of course, healthy diets are the ones that could contribute to a complete state of physical, mental, and social well-being. But when we try to modify or transform our food choices, the way we cook, and so on, we need the support of multiple interventions. And one of the important ones is nutritional education. Moreover, another factor that we need to take into account is that in the past few decades, households have shifted away from home-cooked towards ready-to-eat food. These lifestyle modifications might have impact on our health. In fact, it has been proposed that this could be a possible cause of the growth in diet-related diseases that we are seeing nowadays. So it is clear that improving adherence to healthy eating behavior should be a major priority. And in this sense, we think that a new paradigm is being given in nutrition. So this new paradigm would be defined as, or called as, culinary nutrition, and it is defined as the merging of nutritional recommendations together with culinary skills. And this merging of these concepts would allow or might help to better and more effectively translate nutritional concepts and healthy cooking techniques into more healthy and sustainable eating habits. So these educational interventions that are directed not only to deliver nutritional information to the population, but also culinary skills and resources, might also promote home cooking and thus have an impact on our health. So we think that these proactive attitudes could help to prevent, protect, and also improve these non-communicable chronic diseases. So as an example of a project that we are conducting in this field is this one called Home Cooking, or the word in Basque, Sukalmena, that at the end is that we try to engage patients, type 2 diabetic patients, with nutritional information and with culinary resources, so they could be able to have a better adherence to healthy eating behaviors. So in this study, we try to evaluate the effectiveness of a culinary intervention in these type 2 diabetic patients and to compare these results with the impact that a traditional nutritional intervention could produce. So as part of this culinary intervention, patients are provided with nutritional recommendations on how to follow a healthy Mediterranean dietary pattern, but also are provided with cooking classes, video recipes, and so on. So we seek to obtain measurable health benefits and to compare these results with the ones that we could obtain with a more traditional nutritional intervention. So just to finish, I would like to add that this kind of interventions, together with personalized gastronomy or precision nutrition, are for us, or we understand them as part of a novel nutrition, and that we hope that this kind of actions might allow or might help to improve populations' adherence to healthy eating behaviors. So thank you very much for your attention.
To give the voice to the last speaker of this session. Therefore, I would like to mention that Anaik Garcia wishes to talk about the new generation of consumer that will complement the previous speaker about capacity building, about gastronomy in a personalized manner, and then the role, the views of the consumer, together with the presentation of Professor Ordovas, who mentioned ideas about new trends and new tips in nutrition. Thank you very much for attending our invitation, and in this case, micro and video is yours. And thank you.
Thank you very much. Can you hear me? Yes?
Yeah.
Okay. Well, first of all, thank you. Thanks very much to the IMDEA Food Institute and to the IUNS for organizing this webinar today. And thank you very much, Catherine and Usune and Jose. I took notes about what you just said. I think it's very interesting, Catherine, as you said, we are bombarded of information as consumers, or as Jose said, we need to maybe more focused on food education at school. Or I like the slide that you just put, Usune, about culinary skills. I think we really need, I'm a mother, and I think that our kids would really need to have like programs of food programs at school. And they have math, they have physics, but they don't have food. Food, I think it's a great thing that we should think about. So thank you very much. ¿Quién es el jefe? Is an initiative that just started 1.5 years ago in Spain. Actually, it's a human and collective adventure. As consumer, we are growing more and more aware, and many of us, we have real questions about what we are buying, about what we are eating. So it derives probably from the fact that we are no longer or we no longer wish to purchase and consume products without knowing what kind of impact, for example, they can have on the world around us. So with this initiative, we are trying, or we want to decide where our food comes from, how it is produced, and what price we are ready to pay for it, where our money goes. Taking, in a way, control of what's in our plates and supporting as well producers. We don't have to forget that during this pandemic, the rural sector has been there and we were in the city. So just think about it. And what is really new in this initiatives, that people, you, Catherine, you, Usune, all of us, we can participate in helping creating this new model and this new paradigm, participating while making sense of what we eat. It is time, I think, and I don't just say it in our association and the website that we just created, which is www.lamarcadelosconsumidores.es. Well, it's a channel that we can all participate together. And it is time for us consumers to create the products we want to consume, talking with experts like you, talking with producers, and be also consumer actors, the actors for the change we want for us and for the new generations. So we probably need to know and think that we can decide for products which are healthy, which are tasty, but also responsible. Why not? Towards the environment, towards the animal welfare, and promoting fair trade. So when we created this website 1 year ago, and we decided in Spain to think about the products that we wanted maybe to create, co-create together, we made a questionnaire saying, what would be the top 3 products you would like to vote and validate and create all together? And you know what the answer was? In Spain, milk came, then eggs. Okay, I have them here with me. And I know that the producer would be happy to be with you and with me today to talk about them. And then olive oil, okay? Extra virgin olive oil. So this movement, because it's a movement, this movement exists in Spain, but it also exists in different countries now. People want to know about what they're eating. And this initiative is right now a movement that exists in France, it exists in Greece, in UK, and Italy, in Belgium, in Morocco, in Germany, and Netherlands. So if France voted maybe for the butter and Germany for the potatoes, it's common sense. We understand that. We have different culture, local cultures, okay? But what I wanted to say here is that when we did this questionnaire, when we suddenly say, okay, let's start with the milk, we had every decision was made by a majority of votes cast online. And as completing a questionnaire, we could select product characteristics. So we suddenly found out that we could, as consumers, behave more responsibly. So here, we are talking about fairly profound shift as consumer attitudes. To pay, for example, a fair price to the one who produces behind this product. Indeed, we have checked that farmers, for example, for the meat, will often find themselves accepting derisory prices for their products. Farms are often operating at a loss. In the 80s, I think in Spain, I don't know if you know, there were about maybe 1,000 farms in Spain, and now there are only 12,000 farmers. So what are we going to eat in the future or drink? Milk? I'm asking this, no, as a question. So definitely this initiative is to think maybe that positive change can come from empowering us as consumers. And of course, we have a lot of respect. We have a lot of respect for those who can take of our initiative and choose to be our partners, because we know we are aware of the risks that they're taking. But we strongly believe that the risk is really worth the reward. So I just wanted to finish, because I don't want to take more time, but I think altogether, when we say, well, consumers, in a way, we are all consumers. We all are consumers. And as I said before, this initiative is not maybe to save the planet, but we are working all together. And as consumers, we can maybe be involved and participate in this new adventure. As Mandela said, Mandela was saying always, alone, we go faster. Together, we go further. So thank you very much for your time. And I hope that you can join this community, which started 2 years ago. And I invite you to join the website and participate as well. Thank you.
Thank you very much. Then we have time, about 20 minutes, in order just to have some questions. Some of them have been reached by the audience, and some of them has been generated among the speakers. In first place, I would like to ask Professor Geisler from IUNS about what she thinks about the interaction of consumers and the private sector and organization like IUNS. How can be this relationship maintain it safe, secure for the consumer and for the citizen? The interaction between the private sector, organization like IUNS, please.
Unmute. That's it. I think that's a very difficult question to answer. I think the consumer power is extremely important for any movement, but how the consumer can actually they can make demands, I suppose, on the type of products that they will eat what are produced by the by the food industry. But often they will just have the possibility of not accepting certain things that are produced, rather than having a say with the producers as to what sort of things they want produced. But if we had some good leaders, consumer leaders in nutrition, they would have the power, really, I suppose, to talk to the producers and make the changes that people felt were necessary. The relationship. Yeah.
Thank you. Indeed, I would like you to mention, for example, how IUNS is dealing with the private sector relationship of conflict of interest. Talk about, for example, we have our own guidelines and how this can give some security and at the same time safety to the consumer. Do you think that this kind of conflict of interest declaration could help to be more safe in our investigations, in our relationship with the food companies?
I think it's very important to have regulations for conflict of interest in relation to substances that the food industry might be producing that are not really acceptable nutritionally. And therefore, for groups like IUNS, when we have meetings, it's very important that these sort of products are not promoted at such meetings. It's quite a difficult situation because it's often the food industry that will provide the money for many of the meetings that we have. And so it's very difficult to be careful that we only accept money that is not related to products that are not nutritionally beneficial. So I think all organizations in nutrition really have to be very careful in doing this and have their own policies of interest, conflict of interest.
Thank you, Catherine. I wonder if Professor Ordovaz is still online. If not, I would like to ask Dr. Echeverria about what is the most important project you are developing now in your area of interest?
Okay. Well,
consumer and interactions.
Sorry, Alfredo?
With interaction with the consumer, of course.
Yeah, well, in our projects, we try to interact continuously with the consumer, as we have a research area which is specialized in sensory analysis. So they are the ones that develop focus groups, interviews with consumers in order to evaluate and to validate the acceptance of consumers of the new products that we develop, for instance. So for us, consumers are always in the center of our projects and our development. The micro, Alfredo.
Okay, we will continue later with more questions in your area, but now it's time to have a question for Anaik Garcia. One question that has been reported is, you had mentioned in your presentation, but in any case, there is a question here, how can we empower consumer to take action? Which is the additional views you can just give us in order the role of consumer to take empowerment of own actions or own initiative?
It's a good question. I would like to answer it in a few words, but the fact is that as a consumer, it's the first time that through a social platform that we can involve ourselves and participate. You know, this initiative, which is great, we were talking about education. If you talk about education, it's information. Information power. I didn't even know that the remuneration, for example, of the producer was not giving him enough money to go on further. I didn't know that the cows, you know, when you see a milk pack, you see the cows, right? Passing, you know, in the nature. But it's not true. There's a lot of information that when you see the industry, the food industry, I feel like sometimes I don't have the right information. So I want to know, as a consumer, what is behind the product. How do I know what is behind the product? Maybe participating, involving me, asking questions, and co-create the product together, talking to the producers, talking to the people who do it. And this social platform is a place where all together we can work together, we can talk together, we can talk with doctors, with people who know, experts, but also the people who are there in the farms. And this initiative is something that all together in Spain, we decided because we wanted to know what was behind the products, because we have a lot of questions about what we're eating and what we're buying. And when I go to the supermarket, as I said before, I don't know if I did say that, but when I go to the supermarket and I see two products more or less similar, and I don't know anything about it, maybe I would go to the cheapest one, because what the hell, this one or this one, who cares? Now, if I know who is behind, the raw materials that have been used to do it, the process of manufacturing it, all these things, even if I'm not a nutritionist or I'm not an agronomist person, I want to understand. And I think that through this initiative, we can decide to create the products we want to consume. And we are a growing community of consumers sharing the same values. Completing a questionnaire to select product characteristics is very interesting. And it engages as well the people, the consumers, and as well the producers. So why don't we do it together? I don't know if I answered the questions, but I try. I can't hear.
Alfred, micro.
Then I would like to ask Professor Geisler, because she has been head of department of King's College for nutrition. He has been belonging to IUNS for many years and also has participated in many congresses. my question is, how do you see the future about presential, I mean, in the sessions in the university, the future of the congresses as virtual or just presential, the future of the contact between colleagues? Because I know that, for example, in King's, you have a recording every lecture you give, but now we understand that the personal relationship is very good. How do you envisage? Can you see the future of this situation in capacity building with new problems like COVID and also with new technologies? Then can be good for preparing the professional, but also can be good for the consumer. Can you give you with your expertise, with your good perspective, how is the future of communication? How is the future of the congresses? How is the future of the new technologies in order that food nutrition become better?
Sorry, I couldn't unmute there. It wouldn't allow me to unmute, but that's fine now. Well, I think this COVID really has pushed us forward in a very rapid way to developing new techniques. And I think there'll be an awful lot more that is done electronically rather than face-to-face, both in universities and for congresses. When you think of the amount of money and time that is spent, and also the pollution that is created by people traveling across the world to go to congresses, I think an awful lot of that could be done electronically, although it's not really the same as meeting people on a more individual basis and with an easier relationship. So I think there still have to be some face-to-face meetings. We'll have to improve our electronic means so that we don't keep getting cut off when we're trying to speak on the web as we do in these meetings. So I think that will certainly be improved. But already within just a few months, I think things have improved greatly. If you think of university lectures, the amount of time that is spent in actually preparing the lectures and everybody congregating together just to listen to one person speaking, perhaps with a few questions, I think that certainly can be done much more effectively electronically. But ideas do develop just by being with people and discussing things on a more informal basis. So I do think we have to have occasional meetings at different levels. So I think that's all really I have to say about that.
Thank you very much for your very clever and insightful perspective about the situation of the online courses, about the congresses, and also the lectures at the university. Now, I have here a question for Dr. Echeverria. How do you feel the personalized nutrition can influence different age stage? For example, children, adolescents, adults, and elderly. Do you think that personalized nutrition have different attitudes from different consumer, from different group of age? Which is your vision?
Yeah, of course. I would say that we need to focus on each population segment in order to design foods and the best menus to promote health. For instance, if we take elderly people or senior people, we know that is a really heterogeneous population. So the good thing here, it would be to try to characterize in a detailed way, to characterize this heterogeneous segment, so we could provide the best product, services, and diets at the end, which at the end fulfill their requirements and characteristics and preferences and so on. So yes, I would say, yeah.
Bram, for a marketing point of view, perhaps to deal with children, it's better to deal with the parents in order to do personalized nutrition. How can you approach from a gastronomy point of view to personalize in children when really we need to personalize in parents with children?
Well, I would say it would depend on the aspect that you are focusing, because, for instance, we have some projects that we have conducted with children when we have tried to involve them in shopping and cooking activities, and afterwards we have analyzed if this had a positive impact on their election of the food they did, and it had a positive impact because they choose more healthy food, but for instance, there are some other aspects that are also analyzing nowadays, like mindful eating. We have tried to conduct mindful eating sessions with children, and we have seen that where at least the number of sessions that we have conducted with them have not been enough. They haven't been enough in order to see differences in their way of eating, in the calories they eat, and so on. And these kind of strategies, on the other hand, has been successful with adults, with parents, when parents and children were mixed in these strategies. So I would say it would depend, but if the ideal thing will be to have strategies directed to all the family, parents and children all together.
Thank you very much. We have a question that has been addressed to Professor Ordovas, but I will ask Anaik in the case. What is the most important thing a consumer should know about precision nutrition? What is the most important thing that the consumer should know about precision nutrition? The micro.
Sorry, I had the micro mute. Well, I think that as a consumer, and I can maybe talk about the community behind, but also on my behalf. I think behind the product, what I want when I go as a consumer to buy a product, what I want to have on my plate, I'd like to know a lot of things about the product. And I said it before, nutrition is important. So when you talk to a producer or an agriculture, you ask nutrition about the raw materials they are using. For example, we have done a product, we have created altogether a product with for eggs, right, or milk. or olive oil. So you want to have precision on nutrition, but a product is not only nutrition, it's about also all the things that you have behind the product. And that's why when we did the milk and we want to have it transparent, I don't know if you see the product here, but you have all the details of the product characteristics that we voted all together. And if you see this product, it's not only about nutrition, it's about transparency, it's about fair trade, it's about respect for the environment, it's about animal welfare, it's about collective intelligence. So I think that if you are a consumer, like you are, Usune or Catherine, that you are very expert in nutrition, you have to understand that some consumers don't have maybe this level of information. But I think that we agree that when we eat, we want to have at least products that we know about it. So even if we want a product which is tasty, we want a product which is healthy, we want a product which is responsible. So you say, it's not possible. 2 years ago, lots of people in the food industry would say, it's not possible to have a milk which remunerates the producer fairly, which would be animal welfare for the cow, which would be, how do you say, Spanish origin or local consumer, local product. And we say, why not? Why not? Why isn't it possible? Let's say there's one here and maybe there's one consumer here. We don't want the people the other way, but we want to understand and work all together: industry, distribution, consumers, and producers. It's not so hard to think about it. And I said before, health has been the key point during all this pandemic period of time. But as I said, food is also health. If you eat bad, you get ill. So let's think that food is not only a product. And I'm not here to just show you product. I'm talking about a new model of consumption, a new paradigm, a new way to think altogether.
Thank you very much. Before we close, I would like that Professor Geisler mention something about the future Congress in Japan that is organized by IUNS. Could you give us some of the ideas, the benefits to attend from the consumer, from the students, from the professionals, to attend a Congress, a World Congress, the ICN IUNS Congress in Japan?
Well, perhaps you know the IUNS has a Congress every 4 years. And so it's something rather special. And there's usually about 4,000 people participating. So there's a very wide range of material that is presented. Individuals can participate in seminars. And from the point of view of IUNS, we have several working groups that work on particular issues that are of great importance in the world. And I think they were mentioned earlier in the session this afternoon. So each of these will be presenting the results of really 4 years of working together. So often moving the topic on quite far. It's obviously a wonderful opportunity to meet people from other places, and many research projects, I think, develop after people have met and discussed their interests together. And it brings the possibility for joint working on a particular topic of interest that perhaps they hadn't thought about before they heard somebody presenting a different aspect at the Congress. So the Congress is in September. I can't remember the dates, but you can find that out on the IUNS website. It is going to be in Tokyo, and we're just hoping that the COVID will have reduced by then, to allow us to actually go to Tokyo. Of course, we're going to have to take some decisions as to having possible alternatives if there's too much virus floating around the world. But certainly in the meantime, the plan is for the Congress to take place it's just about 4 or 5 days in September next year. So
thank you very much.
Hope you might
Good
suggest
luck.
something.
Good luck, Catherine. Good luck and have great success for the Congress.
Thank you, and I hope you will come.
Yes, that's right. Hope you can come. Anyway, I appreciate very much your presence in this panel that complement the food, the nutrition, and the consumer areas or sessions. And now I would like just to have a few minutes just to summarize the day and the session we have had so far. Therefore, thank you very much, Professor Geisler. Thank you, Dr. Echeverria. Thank you, Dr. Garcia. And now it's time for closing the session with final remarks. Thank you. Okay, then it's time to have a final remarks about IUNS. IUNS have a web page, you can see there, was created in 1946. There are 11 members from different countries, in this case from Canada, from Germany, from India, from UK, from Ghana, from Korea, from South Africa, from Gambia, from Argentina, from Japan, and from Spain. We have associated organizations like the International Science Council, the World Health Organization, and the FAO, where today we are celebrating the Food World Day. We have 18 affiliated bodies. We have about 81 adhering bodies, in other words, nutritional societies in different countries. The mission, as has been mentioned today, is to promote advance in nutrition science, research and development through international cooperation at the global level, and to encourage communication and collaboration by using modern communication technologies with the current platform today. The action point is to pay attention to adhering bodies and affiliate societies, education and online courses, which some of them they are in our web page, new task force implementation, some of them were mentioned by Dr. Thotor at the beginning, to elaborate document conflicts of interest and private sector, as mentioned by Professor Geisler, and restricted grant seekings, guideline for council members, and of course, to organize the ICN Congress in Japan. Just a list of the current task forces about sustainable diet, nutrition and cancer, precision nutrition, benefit, risk, and cost effectiveness of micronutrient intervention, dietary fat quality, prevention and control of malnutrition, international malnutrition, traditional, indigenous, and cultural food and nutrition, and also toward multidimension management of growth and development. Also, we have a capacity building committee that has a web page with information about e-learning courses, a scholarship to attend FANS, FANUS, FENS, and SLAN, our regional continental bodies, collaboration with regional leadership programs, re-entry grants, funds to cover the fees in selected online courses, workshop at IUNS ICN involving IUNS task forces, IUNS documents for nutritional advancement and communication, as well as webinars, seminars like today. Therefore, the final remark is just to mention that the World Food Day, coinciding with the 75th anniversary of Food Agriculture Organization, try to develop solidarity and understand that everyone has a role to play in the advance in nutrition. Also, the World Food Day, which you can just look to the web page, is aligned with the spirit of the United Nations, where you have the program for food has been granted with the Nobel Prize in this occasion. Of course, one of the interests of this World Food Day is to grow, to nourish, to sustain together. Therefore, the three areas, food, nutrition, and consumer, have been given attention, in particular with emphasis on planetary views from different countries, population views about food prevention, disease prevention by food, and also personalized nutrition. The last very few words is to remember that PPP, population health, planetary health, and personal health, is a cosmos of interest where personalization, population, and the global malnutrition fight play a role. The last is just to remember to attend to the Congress of Nutrition in Tokyo. I want to show you the flyer, but I don't know if we can see now. I don't know, you can see the last slide. This is the final slide. Today is an important day in order to generate interactions in the food and nutrition sector in order to achieve quality of life and well-being. Therefore, the final invitation to attend to the International Congress of Nutrition in Tokyo, organized by IUNS in September 14, 19, 2021. Thank you very much to all of us that attended until the end, and of course, my appreciation to the speakers that have been giving the best to the seminar, to this webinar. Thank you very much and goodbye. Good weekend.
IMDEA Food Institute, with the International Union of Nutritional Sciences, within the framework of the Annual Food Agenda, EIT Food Projects, presents the webinar, Can we ensure healthy and sustainable nutrition? An event released by marketingdirector.com.